A very good morning to you from the University of the Western Cape. Today is day 3 of UWC Research Week 2024, and it is my pleasure to welcome you all to the third day of our Research Week. We are looking forward to a jam-packed day of exciting, innovative presentations. We've had 2 lovely days. We've had brilliant presentations, and we have really benefited as a university and the research community as a whole. Today's session, we are ready to kick off, and we have with us today our keynote speaker who is going to kick off the day's proceedings. And it is my pleasure to welcome Prof. Erickson, who is going to do our keynote presentation. It is also my pleasure to welcome and introduce Prof. Erickson. Prof. Erickson is an academic director at the Center for Values-Based Leadership and Innovation at VID Specialized University in Oslo, Norway. Prof. Erickson is doing research focusing on values and innovation in organizations. He has published on issues like research inspired by phronesis, organizational innovation, innovation and community development, succession of leadership, empowerment, vision and strategy. Before entering academia, he was volunteering in a South African NGO, establishing a national youth organization in Norway, leading a major reform in the Church of Norway, developing theological education in a college in Ethiopia, and leading the international programs of a Norwegian NGO. So this morning, we are so privileged to have you, Prof. Erickson, and we are looking forward to your presentation. So I'm going to welcome you on behalf of UWC and say the stage is yours, and we are looking forward to your presentation. Over to you, Prof.
Thank you so much, Rachel. It's great to be here with you today. I'm really honored, and I've been looking forward to be with you here this morning. And I'm going to share my screen, and we will start the presentation. So I hope you will see my screen well now. I will talk to you this morning about research and innovation for social change, because as researcher we are making a difference. So how can we go about doing that? And I will address that by also elaborating on research inspired by the concept of phronesis. But first, let me say a little bit about the university where I'm from in Norway, VID. It's a specialized university. We are based in 4 different campuses in Norway. And we go back to the 1860s, actually. And research and innovation for social change is part of our DNA. You see the picture of the first batch of students. There were male social workers, nurses, living together, and also in the same house where they were studying, they also took care of elderly men as a part of an integral education, because they wanted to be a powerhouse to mobilize for church-based social work, making a difference in urbanization and poor areas, as you see on the other picture. So that is part of our DNA from the very beginning. And also a lot of the students from this university also went abroad outside of Norway, traveled actually first to South Africa, Madagascar, Taiwan, India, China, Cameroon, different places, started hospitals, churches, theological institutions, other schools, etc. So doing research and innovation for social change is part of our DNA for a long time. And also our relationship with our university and South Africa go way back. Even the first international students to Norway whatsoever came from South Africa in 1866. So there's a long relationship between our institution and your great country. Today, VID is a modern university with different campuses, often co-located with hospitals and other social institutions as an expression of our social ethos for making a difference in real life. And our relationship with South Africa and with UWC in Western Cape is still going on strong. We have a partnership on sustainable community development and eco-social change, also together with the University of Malawi. So we are still in cooperation, and I'm really happy to be joining you here today as well. And our motto as a university is we are committed to humanity locally and globally. And this picture, I really feel it says a lot about social innovation and today's theme, because to really make a difference in our research, we need to push each other and we need to dream together, but we also need to love one another. So I think this picture says a lot about our theme today and what we are really about. So today I'm going to focus my presentation on two topics. First, about engaged scholarship, research addressing grand challenges and wicked problems for the common good. And then I will elaborate more on research inspired by this old Greek concept from Aristotle, phronesis, as one way of conducting engaged scholarship.
Apologies for the interruption, Prof. Eriksson. Can you change your presentation format so we can just see the live slide and not the...
Yes. I guess now it's better then.
Perfect. Yes. Thank you so much.
Thank you. Yeah. So these are the two topics I will delve into today. And let me start with the engaged scholarship, because we are all about now to this research week is all about research and innovation for advancing progress towards attaining sustainable development goals in emerging economies. But there's a limited understanding of how research and innovation contribute to social change in these economies. And in my opinion, it all starts by addressing questions worth answering. So as a researcher, I would say the fundamental starting point, what are the questions worth answering? These are the ones we need to focus on. And in my opinion, it has to be about improving well-being and flourishing lives for human beings. That's what we're all about. So, and also the ecosystem to have that around. So as a research disciplines, they are not only a collection of methods and theories, they also foster a sense of questions. Questions are worth answering? So I just want to start by asking you, what questions do you think are worth answering? In your school, your department, or your institute, what questions are worth answering there? What questions are you exploring? And what questions do you consider worth answering? Maybe there are some questions that are currently not addressed that should be answered. Maybe those are the ones you should dig into and to make a difference. Engaged scholars are continuously rethinking and reframing what these questions are and how their research addresses the current and important phenomena in the real world with a view to impacting society. So I would encourage you today to venture out as engaged scholar to really find what are the questions worth answering and exploring. And one perspective is about grand challenges that are commonly defined as a specific critical barrier that, if removed, would help solve an important societal problem with a high likelihood of global impact. So a grand challenge is a highly complex and wicked in nature and may never be fully solved, but they are for sure questions worth addressing. So they would include climate emergency, digital transformation, different forms of inequality in different ways. So these grand challenges should be addressed and tackled in all kinds of different disciplines that you are represented at the university and elsewhere here. So these grand challenges, they really expand the questions worth answering, and they can really also motivate researchers to rethink their role within society. Are you only researching and publishing to build your academic career, or do you want to take another role to really impact and make a difference in society? And that's my challenge for you today, and really to how can we as a researcher contribute to the common good, for the ecosystems, for the human flourishing and well-being. And the common good is accessible to all members of a society. That's the really key importance of that, the common good. And it refers to contextual conditions that contribute to human well-being and flourishing, like prosperous communities, environmental sustainability. So how can we as a researcher contribute to that? So let me sum up. Engaged scholarship is addressing grand challenges and wicked problems for the common good. And how can you and I and we as a research community really debate and discuss what are the questions worth addressing, and then rigorously research into that to make a difference. And there are different ways of doing engaged research. It can be more like informed basic research undertaken to describe, explain, or predict a social phenomena, or it can be more collaborative basic research, which is more sharing power and collaboration between researchers and other stakeholders. And it can be more of a design and evaluation research, focusing more on normative knowledge related to design and evaluation. And it can be even more active in an action research that involves intervention to address some of these problems worth answering, and where you also you make a difference in real life as well as you create academic knowledge. So engaged research is committed to bridge the theory and practice, and it allows researchers to use different methodologies, just quantitative and qualitative, but it is mainly defined by this bridging theory and practice and wanting to make a difference. So I would really encourage you here to move in that direction, to see how we can make a difference and contribute to innovation and social impact. And now I will move on to, because there's many different ways of doing engaged research, but I will today focus on one way of doing that, how you can conduct research inspired by this concept phronesis, which could be translated to modern English as practical wisdom maybe. And I've written on this together with a colleague on how doing research in this way could simultaneously extend knowledge, improve practice, and refine values at the same time. So the rest of this presentation now will focus on how to conduct research inspired by phronesis. And this is an old concept stemming from Aristotelian thought. It concerns values, and it goes beyond the analytical scientific knowledge, which he called episteme, and that we know from English as epistemic. And it also goes beyond the other notion of technical knowledge, which in Greek is techne, and we know from technology. But phronesis doesn't have the same modern word used in our vocabulary today. And it also may say something about science and how we think about knowledge, since this has been somewhat dwindling along the centuries. But phronesis involves the application of practical wisdom to discern how you can advance in practicing what is good or right in this specific situation. So that is the aim of research inspired by phronesis, to increase that capacity of advancing what is good and right in this specific situation. And phronesis is a form of knowledge which is enacted in the situation. It is a practical wisdom based on also incorporating a moral purpose to act for what is best. It involves deliberation, reflection based on values, and it's also concerned with practical judgment. It is practical, variable. It's also context dependent towards action. And I think if the world should mention one example of a person really being, impersonating this practical wisdom, acting for the good, I think Mandela would be one of the first names that pop into mind. Like yesterday, I was out in Oslo in a restaurant. You have portraits of Mandela. You have, so many people are looking for him for inspiration, and also I think because he's also embodied that wisdom. And research inspired by Phronesis opens possibilities of realizing both co-development of theoretical knowledge, reflection over values, and improvement of practice at the same time. So that's the ideal or for conducting such kind of research. And it's also Flyvbjerg, he's a professor at Oxford. He also said that in this phronetic approach, there's a goal that to produce knowledge that the people being studied themselves can use to better address the problems they're experiencing. So Flyvbjerg, he wrote on this extensively on how social science, how research can matter and make a difference. And then when targeting the goals of combining both the knowledge creation, the practice improvement, and refinement of values, you should design a research that include practitioners and also facilitate reflection throughout the process. This approach in research relates to values, and so some underlying questions would be there, like where are we going? Is the development we are seeing, experiencing, is it desirable? What, if anything, should we do about it if it's not? And then you relate to questions of power. Because changes would affect people's interests and positions, and then there's a question that who gains and who loses, and by which mechanism of power. And here we see there's also this communal approach, that where are we going and what should we do about it? But then who are we in the question asking the questions? Are all the voices represented here? All the voices for those who are influenced by decisions, by the development? Are someone here without the voice? How can we facilitate and include all voices? So in this approach, we also are very concerned about perspective, about standpoint. So we're also, influenced by feminist theory, about decolonialized perspectives, liberation epistemologies, and so we want to create an inclusive environment where all voices can be heard. But then, of course, how do you translate this into research design that you can actually, conduct research inspired by this? So one of the things is it involves deliberating and exploring what the challenge actually is. What is the questions worth addressing here? What is the deficient framing of the problem? Investigating the values underpinning the practice and understanding the processes and deliberating and then what is at stake here. So it takes a collaborative approach to do this. And to be more specific, when translating this into research design, it's about collectively developing together with practitioners, together with those who are in real life experiencing the challenge or the development or the issue that you would like to address and research on, collectively develop the problem formulation, what is at stake here, and then go about what kind of research tools, data gathering methods should we apply here? What would be relevant for us to do here? Would some tools omit important information or not? Then you could collaboratively also do the data gathering, the analysis, and also the drawing of conclusions. And I will go into more details in this. So in that way, the research turns into a mutual learning process that can advance both theoretical and practical knowledge. So I don't know, I hope you can read this. I don't know if it's too small, but this is the step-by-step process here. And in the research design, it's a collaborative research design that participants and researchers agree on the focus for the inquiry itself. And let me use an example in my research on, I'm now doing a research project on innovating organizations for sustained social impact. I'm doing that with 2 global organizations. And with one of them, I did this collaborative research. And then together with some of the global leaders in that organization, we were discussing, okay, if we should have this collaborative process together, what theme or what topic would be relevant for you to explore? And they came up with the notion of what are appropriate ways of leading and collaborating in a polycentric reality? That was their question worth answering. So we went with that. And then we invited key stakeholders to be part of this project. And we had an introduction meeting online where we presented the project, the overall topic, and invited them to take part. And then they decided upon subtopics related to the overall theme. And they decided how they could go out and gather data on that, interviewing people, researching documents, reflecting on their own experiences. So they gathered data. And I also did the same, conducting interviews, participatory observation, document studies, etc. So then after 3 months, we met together online again, presented preliminary findings. So we had like a safe space online, where facilitated, curated, and where all participants shared their preliminary findings, their interpretation, and then we commented on each other on these findings. And that created a lot of new insight for me as an external researcher and facilitator, and also for them. And that created a lot of reflection on their part, which were all data to me, but also helped them to increase their Phronesis practical knowledge on this. And then I gathered all the data coming out from the previous steps, and then I analyzed, and like we usually do. And then I went back to them again in a participant validation meeting, where I presented my preliminary findings, and they, as research participants, they commented upon that. And that, again, for me, created more new insights for me again. So I took that back to the final analysis, where I reflected on the preliminary findings, the response from participant. I adjusted analysis and the conclusions, and then the final results I'm then presenting in articles to a wider academic audience. And also there's takeaway from the participants that they take into their practice in their organizational life. And I just want to share one quote from one of the directors that were part of this. And he said, as we were summarizing this collaborative research process inspired by Phronesis, he said that what emerged a few times over the course of these days is the importance of values. And that I was wondering if it would be worth revisiting our values. I mean, we have core values that are written, but there are also other values that actually shape in practical ways what we do. And I suggest that we revisit those values and think about them from the point of view of collaboration, which was the theme. And ask ourselves, what would values be that would truly help us? For example, one thing that came to mind would be to say something like, money shouldn't be the driver for collaboration, and then commit to hold ourselves accountable to actually live those values and learn what they mean. So you see, his reflections on being part of this research process really increased his reflexivity and influenced how he would lead and how they as an organization would think about values, and also improving their practice in a sense. So it's I would say an example of how this way of conducting research is both producing academic results, like me publishing articles, but also helping them to reflect on values and improve their practice at the same time. But this way of doing research is not without its challenges as well. So let me finish now by pointing into some challenges and how you can navigate those, because and one of them is resource intensity, because of course it requires time and resources for the participants to take part, not just being interviewed or observed, but also take part themselves in the whole research process. So, and then of course, do they have resources to do that? Do they have time for that? It needs to be accommodated. So that's one challenge. And another one is, I don't know if it's challenge, but it's what constitutes data in this type of research. It's because for me, as the external research partner in this project, all the steps in the process yields interesting, rich and complex data for me, from planning the process, from conducting the process, from the participant validation, from the communication along the way. And that needs to be clarified due to ethical reasons to the organization, so they know that everything from this process is relevant material for me as an external researcher here. But it does produce rich, complex, and maybe possibly conflicting material that is suitable for theorizing and pushing theory further. But they need to be aware that the whole process is informing my final analysis. So there's some ethical considerations there. And then we need, of course, to be aware of the power asymmetries, both between us as researchers and the non-academic participants, but also the power asymmetries between them, like different organizational levels maybe, or different positions, social locations, all these asymmetries that might be there. And then the importance to, especially as reflecting together, is a key method. In the importance of creating safe spaces. Maybe you need to meet outside of the usual either physical place or time to set up a third space where you can meet on a neutral ground, where all can have a voice. You need to curate or facilitate this space very carefully to set up rules, and our intention is to learn and explore. So trying to establish a non-threatening, safe environment where people can feel safe to voice their concerns and their real perceptions and thoughts. And that needs to be facilitated quite carefully. And that takes maybe some other skills than a researcher normally have, maybe. So that is one challenge we'll need to navigate. And as a researcher, you need to navigate between closeness in order to gain access and trust with the participants, but also you need to keep your distance in a sense as well, to stay reflective and critical of the assumptions, both in the theory and also in the practice field. So you need to navigate closeness and distance to do that. And that also requires very a reflexivity on behalf of you as a researcher. And then even if we claim that this way of conducting engaged research inspired by Phronesis can also combine academic results and improve practice, we also need to acknowledge that in a lot of incidents, there's external factors that are framing or influencing the situation. So to achieve real change, you need to address those external factors. And then you need to go outside of participants. You need to communicate findings to a wider audience, to create public awareness and debate in the news, different ways of doing that. So then you need to move beyond just the research participant within the situation, in a sense. But I think overall, by navigating these challenges, by addressing questions worth answering. It could be grand challenges, it could be wicked problems, it could be, you know, together with in a collaborative approach, you could define and describe what are really the key challenges we need to address here. And then doing that in a collaborative research design, as I've tried to explain here in a research inspired by Phronesis, you could, as a researcher, achieve the double outcome of both social impact and academic results. And I think if we are successful in that, I think we can really make a difference toward, you know, achieving the SDGs and making a difference. And to me, as a researcher, at least, I find deep motivation in that. How can I, in my role as a researcher, how can I tackle and help address some of the grand challenges of our time, and to, in some small little measure, how can I contribute to the common good for humanity and the ecosystems? So that is my take on this, and that is my hope that I've shared some inspiration for you and how you can go about doing that. And this is more described, of course, in this what I published on research inspired by Phronesis, and you also see the other references here then that I'm building on this presentation. But thank you very much. This was my presentation on engaged scholarship towards contributing to the common good.
Thank you very much, Prof. Eriksson, and that was such an enlightening talk, and speaking closer to the issues that we face all over the world, even here at home. And I just want to appreciate you and the time that went into the preparation, and also for sharing your insights into the work that you've done, and also the practical, you know, examples of how you've engaged organizations over time. That was very valuable, and we really appreciate it. Thank you so much. We do have allocated space of time for us to engage with you. So I'm going to check with our audience if there are any questions that they'd like to raise. Any questions for Prof. Eriksson? Any comments? Prof. Franz, over to you.
Good morning, colleagues. Good morning, everybody. Good morning, Prof. Eriksson. I'm so glad and excited to see you here at our research week. I like the challenge you posed to us, where you said we need to ensure that our research contributes to societal impact. But we also realize that this remains a challenge because impact in society through our research happens over time. And so my question this morning is, how do we as academics kind of monitor and evaluate the impact that we are making? I like the way you engaged in your presentation in terms of what you are able to do and how you have collaborated, and what the role is of the academic with others, and the impact, and using values as a measuring stick kind of to do that. And that is not what when we talk. I'm saying we always focus impact on citations and you know, publications, etc. So what would be practical steps that you could give the audience in terms of academics looking to see how are we actually doing with our research in terms of societal impact? Thank you.
Thank you, Prof. That's a really good question, and I'm not sure if I'm able to answer it fully, but I think it's a good question to ponder for all of us. But I think at least your starting point is that you're saying that, you know, usually we measure our impact in citations and publication points, and so I think a really important starting point would maybe to question that and to say, are we happy with just settle for citations and academic impact, or would we try to look for societal impact as well? And of course, that is harder to measure. But of course, it depends on disciplines. If we you know, develop technical solutions to practical questions. You can see, are we finding solutions that are being implemented and used, actually solving different practical, social, ecological, economic problems? That's one issue. Or for me, in organizational studies, I would maybe I would need to, more like over time, keep touch with the organization to see, are they improving? But it's harder to find very detailed, specific indicators. But I think that we should look for those. And maybe we need to develop our incentive systems within our academic institutions to value those type of social indicators. Maybe as much as citations and publications, maybe. So, but thank you for the question. Of course, I think this is an ongoing conversation.
Yes, I agree with you. We need, it's institutional based that we need to start having the conversations in terms of how we actually start to measure societal impact. Because the current status of doing research where we go into communities, we go and do research, and then we move out of community to the next one, which is saying that we are into societal impact, and therefore we need to think differently about it. But yes, like you said, it is a conversation that we need to engage in. So thank you so much. Thank you, Carl.
Thank you very much, Prof. Franz, for that engagement with Prof. Eriksson. We also have another comment, and I'm going to invite, is it Professor Bulela Gweja, for your comment, please? Okay, we don't have that, but while we're trying to get the comment in, I just wanted to raise something with you, Prof, and that is, the first a part of your talk was on engaged scholarship, and you spoke about the wicked problems that we face, and you were specific about what the issues are, like the climate emergency, that we're facing as the whole world, and also digital transformation and all forms of inequality as the grand challenges that we're facing. So I wanted to engage with you and find out, your thoughts on how do we talk about engaged scholarship, and as academics, what is your take on how we engage with communities that are sensitive communities, marginalized communities, and how do we engage with such communities, sometimes very diverse in terms of race, culture, also religion, ethnicity, nationality. So, what is your take? What are the ways in which you would say that we can best engage with such types of communities? Prof?
Yeah, thank you for an excellent question, and I think there's different answers, and I would just say that we my take or starting point would be to say that, okay, we are respect and as our common humanity, that we are together facing challenges of life, and we need to build that common respect, and our my attitude and our intention as researchers should be to contribute to the common good, and not just coming outside as experts researching these specific community for scholarly interest. We need to have a respect and our intention to really and then from that develop a relationship and explore with them based on that trust what are their key issues that they are facing and that they would like to explore. So it's more from within, in a sense, of course, and then there might be very conflicting perspectives within such a diverse community, so you need to be aware of that as well. But I think that the foundational attitude would be that I'm not exploring them from outside because of a theoretical interest, because we need to be careful not to just use them for our research, extracting knowledge from them that I will publish and I will shine from that. But how can we together make a difference and really so their voice would be heard in a sense? But then to build that trust, it takes time. And I need to earn that trust maybe and find ways in. That would be some of my reflections, but I guess you would have even better reflection on that as well yourself. So thank you.
No, thank you so much for that. And I think that is one of the, going to the next part of what I wanted to engage you on, and that is the phronesis that you mentioned. We all, as researchers and academics, are engaged to extend our knowledge and wisdom, but the values issue. So, to reach a point of shared values also takes the issue of trust, very deeply as well. So, with the communities that, or the stakeholders or the organizations that you have engaged and worked with and assisted, how do they normally, work on a system or means of actually coming up with shared values? What are your thoughts on that? How do we reach shared value?
Excellent question. Excellent questions. And what they have done is that they have really taken good care of facilitating and establishing these safe spaces, or looking for a third space, or so they would be very careful in getting all different perspectives represented in the room. And then they've had a lot of time for facilitated, careful table discussions on key issues related to values. And that has they've done that over years in these organizations, global organizations, because they tackle questions of power from the so-called global north and the so-called global south, and money and power and decisions, and how would they facilitate questions about values that could challenge those power asymmetries. And they went on for years, actually. I think they had 25, 30 plus these kind of consultations where they were discussing key issues on funding, and they came up with value statements. Like, instead of funding, they were talking about generosity. Everyone can share, everyone has gifts to bring to the table, and celebrate those. And so they were, I would say, carefully facilitated safe spaces where all voices were concerned. And then they would, like, intentionally, they would always let the non-English speaking start first. So you don't have the fluent English speaking controlling everything, but they would give the word to those first. So they would be very careful in facilitating those conversations. That's at least one thing they did.
Yeah, that's very interesting, because the trust and the values also goes hand in glove with each other. Values, every community, every society has different values, and to bring them onto common ground where they can work together is actually a process. And I think you've touched on the challenges as well, negotiating those safe spaces, etc. That actually makes a big difference. And it's also not something that can be done overnight. As you're saying, in some instances, it actually takes years of working together to reach the trust, and also to be able to understand and share the values. Yeah. But thank you so much for that input. I just want to check with our audience. Are there any other questions or comments for you? Okay, so we have a comment. One of our participants is unable to switch on the mic, so I'm going to read out his comment to us. He indicates that he would like to suggest that we use African solutions to our African problems. He would like to speak on indigenous knowledge, which is likened to Aristotle's practical knowledge idea. And just give me 1 second. And also Nelson Mandela and other struggle heroes emphasized on natural law, where they explained our inherent duties to promote civil rights and equality. And even in South Africa, our participant says is Ubuntu is actually an example of an African jurisprudential concept. And she says that I'm a female law student at the University of the Western Cape. So I think that's quite a significant comment to make. Do you want to add something to that?
I just want to thank you for the comment, and thank you so much. And I think I totally agree. And I would really appreciate your comment and just wish you all the best in exploring that. And as a law student as well, how can you elaborate on Ubuntu as a concept and a solution to different issues in that? So I totally agree, and just want to thank you for making that comment. Thank you so much.
Thank you very much. Thank you for the questions and the comment. And Prof. Erickson, I think our time is up for our session. I just want to really appreciate you and for delivering the keynote address at this morning's opening of our day 3 of Research Week. And we want to appreciate your knowledge that you shared, some of the experience that you shared with us. And we hope to be partnering together with you further in the future, as well as with your country as a whole. So thank you, very much appreciated, and thank you from the entire team and the university. And with that, we want to bring the keynote session to a close. And I just want to appreciate everyone who has participated. Our next session is going to be handled by Prof. van der Berg, and I'm going to invite her to start introducing the session. Thank you, everyone, and goodbye from me.
Good morning, everyone. Thank you so much, Rachel, for that introduction. I appreciate it. And thank you for having me as a panelist today. I appreciate it. I have the privilege of paneling our first session for the day, which is on topics regarding One Health. And we have, I think, 5 speakers. Yes, 5 speakers. We're going to be hearing from Ms. Tisha, Ms. Violeto Madasa, Dr. Castillo Blakesmore Maram, Dr. Tanya Stell, and Dr. Dada Uluwasi Timula. Apologize if I don't pronounce the names correctly. Our first speaker for today is Ms. Tisha. She will be speaking on the perceptions of nurses with TB and HIV adherence. Ms. Tisha began her career at the Khayelitsha District Hospital, where she worked within the maternity unit, and then she moved to Wynberg Military Hospital. She transitioned into clinical trials focused on HIV and TB at Task Applied Science at the Desmond Tutu Center. Since 2017, she served as a lecturer at the School of Nursing, where she was involved in both classroom and clinical facilitation for general nursing. She's also a second-year level coordinator. Ms. Tisha has authored and co-authored publications in reputable journals, including Curatonus, Health SA, Gesondheid, and Nursing Research and Practice. Additionally, she serves as a reviewer for Curatonus. I then welcome you, Ms. Tisha, to start your presentation. You have 10 minutes. And then just a reminder that I'll be switching my camera on when you have 2 minutes left, and then you should wrap up. For those of you who have questions, you can hold them until the end of the session, and we'll have a Q&A session. But thank you very much.
Good morning, everyone. Good morning, Prof. Thank you so much for the opportunity. May I share my screen now, or you are going to share from that side?
You can share your screen.
Okay. Thank you. Can you see the presentation?
Yes, we can.
Okay, Prof. Thank you so much. Let me put it in the slideshow mode.
Your screen appears correctly.
Okay. Thank you so much for that confirmation, Prof. So this morning I'm going to be sharing with the team part of the empirical data of my PhD study titled The Perceptions of Nurses on TB and HIV Adherence Counseling Skills in a Health Sub-District in Cape Town. So this is a qualitative study that forms part of the empirical phase 1 stage of my PhD study. So just a brief background, people living with HIV co-infected with TB account for 1 in 3 HIV-related deaths. Retention in care and adherence to medication remain key behaviors that people living with HIV and co-infected with TB must adapt to achieve better health outcomes. Nevertheless, TB and HIV adherence counseling services provided by nurses designed to enhance these behaviors remain inadequate. Additionally, limited information is found in the literature on the perceptions of nurses regarding their TB and HIV adherence counseling skills pertaining to this specific group of people or patients. So the aim of this research is to explore and to describe the perceptions of nurses regarding their TB and HIV adherence counseling skills of people living with HIV co-infected with TB in this specific metropole of Cape Town. So the setting is in a health sub-district in Cape Town. So method and exploratory descriptive qualitative design was followed in this study. A total of 14 purposely sampled nurses were interviewed individually. Nurses caring for people living with HIV were included, and nurses not offering care to this group of patients were excluded. All interviews were auto-recorded, were audio recorded with the participants' permission, followed by verbatim transcription of the data. Thematic analysis was used to analyze the data using the Atlas TI software. So the results of this study, it was established that varied roles of these nurses caring for this specific group of people express increased workload. Nevertheless, despite the gap in their counseling skills, majority of these nurses still maintain work expertise, professionalism, and empathy towards this specific group of patients. Additionally, there were some barriers that impacted patients' attendance of their follow-up visits at these specific CHCs and community healthcare centers. So with the results, because of time, I'm just going to talk about one theme and one category. So the first theme is the complexity of the varied roles of the nurses. So the nurses' collaborative roles with external staff and lay counselors improve their adherence counseling skills. This resulted in the first theme, which reflected the complexity of the varied roles of the nurses. This theme had 3 subcategories, but I'm going to talk about one only in this presentation. So the first category I'm going to talk about is the educational role of these nurses. So the nurses who are the participants reported that they perform many roles embedded in the adherence counseling of this group of patients. The educational role was one of the key roles that these nurses express that they carry on. One of the participants indicated that when you are starting the treatment, you explain why it is important to take the treatment, and you explain to the patient that the treatment is a lifelong treatment. You are not going to stop the treatment. You browse and tell them, that is the patient, that every treatment is different, and most of the treatments do cause side effects. So this is one of the extracts from one of the participants. However, there were some challenges experienced while carrying out adherence counseling of this specific group of patients, which is time constraint and workload. And one of the participants, one of the nurses, indicated that in that specific clinic, let me quote what verbatim, this clinic is too big to do ARVs and TB. You don't have time to reflect because there are many patients to attend to, so no time. So this is when you miss most of the things you are expected to inform the patients on. What you are doing is just to give them their treatment. So time constraint and workload were one of the challenges that impacted the offering of adherence counseling to this specific group of patients. Also, the educational role of the nurses serve as a source of acquiring skills to carry out adherence counseling for people living with HIV, co-infected with TB, because of their close interaction with these patients. So in brackets, we indicated as a human relationship, hence a source of equipping the nurses with adherence counseling. One of the participants in one of the CAT, who is a male professional nurse, reported that most of the time you will find out that they are not taking the treatment, especially the TB treatment, because they believe that if they finish the 6 months treatment, they are not going to get the disability grant again. So they will not take the treatment because they want to maintain the disability grant. Hence, they manipulate the system. So I'm going to now move to the second theme, which is display of professionalism by the nurses. Display of professionalism by the nurses despite the challenges of workload, time, etc. Creating a good nurse-patient relationship has an interpersonal impact when caring for people living with HIV, co-infected with TB. The nurses displayed professionalism and good human relationship with this group of patients despite their co-infection status, the use of substance, and tobacco. This is now the first category under that theme, importance of positive relationship. Some of the participants reported that they created a friendly and conducive environment for the patients to win back their trust onto their treatment plan. One of the participants, who is a female professional nurse, reported that you must give a smile every day so that even if he is at home, he remembers your smile and will come back for treatment. Another participant reported that you will have to sympathize with them, because if you are not going to sympathize with them, you would not know the reason why he or she is not taking the treatment if you keep on shouting at them. Instead, you have to learn to listen to them. And one of the last participant reported, a male also professional nurse, that just be a person, not a nurse, when you are talking to them. So the researcher also asked the question, this question to the participants. Sister, what do you think Sister, do you think you have good adherence counseling skills to counsel this group of people that are infected with both HIV and TB? So one of the participants' response was that, yes, because you tell them, you must not be scared of these tablets, especially the youngsters. Some of them are actively consuming alcohol and tobacco. Professionalism through good human relationship was also reported by a participant who felt that part of the adherence counseling skills was emphasizing and repeating everything over again. So this participant went verbatim reported, I think you try to emphasize and repeat everything over again. But the main thing about relapse is you find out the reason for the relapse. But you must create that patient-nurse relationship so that the patient can trust you enough to disclose where the problem is lying. This is the last theme, the role of expertise and experience. Adherence counseling from experience, when they encounter these clients who were not adhering to their treatment plan, emerge as a strong theme. Their adherence counseling skills was based on their day-to-day interaction with these patients. Adherence counseling from experience at the point of treatment initiation, continuation, and end of treatment did boast the adherence counseling skills of some of these nurses. So this is the first category under the theme, which is counseling from experience. So 9 out of the 14 participants who were interviewed who were interviewed reported that counseling from experience, they were counseling from experience. However, they felt that this was not an adequate adherence counseling service they were offering to this group of patients at the point of treatment initiation, continuation of treatment, and end of treatment. In responding to the question on what adherence counseling service do, on what adherence counseling services they had been offering and how they acquired the skills, the following responses were received. The first
Ms.
participant-
Tisha, my
Yes.
apologies. You have to wrap up. Your 10 minutes is over.
Okay. Is
Thank
1 minute
you.
fine, Prof?
Yes, thank you.
Okay. Okay, I'm just going to go through one extract here. So one of the participants reported that I didn't get any formal training regarding adherence counseling. It's from my working experience. No one trained me to counsel. I just counsel the patients as they present. So in total, in a nutshell, we can safely conclude from this study that reinforcement to treatment adherence counseling should be ongoing at every clinic visit, and nurses should provide this using their experience. They should be trained on how to carry out adherence counseling. Thank you.
Thank you so much for that presentation. I see that we have some comments in the chat. I'm going to park them for the end of the session when we have a Q&A. Our next presenter is here. This is Ms. Violetu Madasa. Violetu, if I may, you're welcome to turn your camera on or to start sharing your screen. Just some housekeeping, because I think you missed the announcement. You have 10 minutes to present, and when you have 2 minutes left, I will turn my camera on to notify you of that. Questions are put in the chat, but we have a Q&A session at the end in which we'll address questions. All right, I would just like to introduce our next speaker. Ms. Violetu Madasa is a lecturer in the Physiotherapy Department, Faculty of CHS. She is a current PhD candidate in the School of Public Health with an interest in disability, school health, and inclusive education. She holds a master's in physiotherapy from the University of the Western Cape. Ms. Madasa has postgraduate research supervision experience, has published in accredited journals, and has presented her work at an international conference. She will be speaking today on knowledge, attitude, and practices and self-assessment anxiety of undergraduate physiotherapy students during the COVID-19 pandemic in South Africa. All right. Ms. Violetu, I give over to you.
Good morning, everyone. I just want to check if you can see my screen.
Yes, we can. Thanks so much.
Okay. So my project is titled Knowledge, Attitude, and Practices of Self-Assessed Anxiety of Undergraduate Physiotherapy Students during the COVID-19 pandemic in South Africa. So the globally, COVID-19 took a huge toll on healthcare professionals and communities worldwide, with dense communities being particularly at risk. The rapid and wide-ranging spread of COVID-19 was of concern for healthcare professionals too, and those working in the front line were particularly vulnerable. And a decade ago, a Lancet Commission report on health education concluded that there is a huge discrepancy between the demands of population health and the services that can be provided by healthcare professionals. In the era of COVID-19, one of the new infections suggested by the Lancet Commission report, it is therefore important to get a sense of future healthcare professionals such as physiotherapy, students' knowledge, attitudes, and practices in terms of the disease. The role of healthcare professionals such as physiotherapists has expanded from being clinical practitioners to becoming a member of a healthcare team involved in healthcare promotion, disease prevention, community development, and advocacy contained within the notion of social responsibility. The role of physiotherapists in hospital and ICUs has been well established globally. And because of the drastic increase of patients infected with COVID-19 worldwide, many countries considered sending their senior or final year students back into the workforce. The latter could be seen as a stressful situation for those students, as they should be viewed as inexperienced in the pandemic crisis and could lead to psychological distress. Holmes et al. Warned that both the direct and indirect psychological and social effects of COVID-19 pandemic are extensive and could therefore have an effect on mental health, not only now, but in the future too. Physiotherapy students' contribution to the nation's future workforce during COVID-19 pandemic raised questions regarding their knowledge, attitudes, and practices towards COVID-19 and the psychological distress and anxiety that they experienced. So the aim of the study was to determine the knowledge, the attitude, the practices, and self-assessed anxiety of physiotherapy students during the COVID-19 pandemic, and to also determine whether the knowledge, attitudes, and practices towards COVID-19 were associated with the self-assessed anxiety of physiotherapy undergraduate students at UWC. The objectives of the study were to assess the knowledge, the attitudes, and practices of physiotherapy undergraduate students towards COVID-19, to assess the self-assessed anxiety of physiotherapy students during the COVID-19 pandemic, and to assess the association between the knowledge, attitudes, and practices towards COVID-19 and self-assessed anxiety of physiotherapy undergraduate students. A quantitative cross-sectional online design was used, and the study was concluded was conducted at the University of Western Cape Physio Department, and an estimated number of 271 students were registered and approached to participate in the study in the year 2020. The research instrument that was used was the online self-administered questionnaire, which consisted of your demographic characteristics, the COVID CAP-19, which has 16 items, of which 12 include knowledge, and then the self-assessed anxiety measured by the general anxiety disorder. The ethical clearance was obtained from UWC HSREC, and the permission to conduct the study, because we had students, was also obtained from the registrar of UWC. And the data was collected by means of an online self-administered questionnaire that was sent to the student population. The questionnaire was accessible for 2 months, after which it was closed and no further responses were accepted. Responses were monitored through the total numbers submitted, with 2-week reminders that were put in place to increase the amount of participants in the study. Data was captured automatically in a Microsoft Excel spreadsheet via the Google Form online platform, and the data was then coded and imported to SPSS version 29. Descriptive data such as your demographic data, item scores, and domain scores from the CAP COVID-19 and GAD-7 were analyzed using frequencies, percentages, means, standard deviations, medians, and interquartile ranges. Knowledge scores, attitudes, practices, and self-assessed anxieties of different categories, such as your gender, your age groups, year of study, and a place of residence, was compared with an independent test, ANOVA and chi-square test as appropriate. The significance level was set at p less than 0.05. We had a response rate of 45%, with the mean age of the cohort being 21.1, and majority of the respondents were female and they were living with their parents. The mean knowledge score was high, presenting a good knowledge base regarding the clinical presentation and transmission routes, preventing and controlling of COVID-19. In terms of students' attitude towards the COVID-19, the majority of respondents agree that COVID-19 would finally be successfully controlled, and majority of the student respondents had confidence that South Africa would win the battle against COVID-19, whilst 30.1% had no such confidence. With regard to practices of COVID-19 pandemic, the majority of the participants had not visited any crowded places, and almost all wore masks when going out. There was still a third of participants that visited crowded places, and a small portion who had not worn any masks when going out. First-year students had significantly lower knowledge scores than other year levels, with no significant difference in the level of anxiety amongst the year levels. Where students resided also had no significant association with CAP and GAT scores, nor were the attitudes or practices towards COVID-19 associated with knowledge scores. The mean GAT score out of a total of 21 was low, representing a level of anxiety experienced by the students. The majority of students experienced problems with anxiety-related items in the table over the last 2-week period prior to the completion of the questionnaire. So the study provided insight into the knowledge, attitudes, and practices related to COVID-19 pandemic amongst physiotherapy students in Cape Town. This predominantly female cohort had an overall correct rate of 89% on the knowledge questionnaire, indicating that most respondents were knowledgeable about COVID-19, which is similar to the findings of Zhong et al. In a Chinese population where residents were aged 16 and above, and they were female with a bachelor degree or more from Hubei and other Chinese provinces. So therefore, this can be interpreted that our student population were on par with their knowledge compared to those that were already qualified or higher educated. The latter was especially noted in the final year students who would be returning to the clinical platform to treat and manage patients who might have been infected with COVID-19. The study therefore highlighted the effectiveness of the PPE training and COVID-19 education that the students had received. Despite the positive attitude towards the success of fighting the battle against COVID-19, the physiotherapy students were still very cautious, and the majority avoided crowded places and wore masks when leaving home, similar to Zhong et al. The latter also speaks to the level of anxiety measured by the GAT-7. The students had a moderate level of anxiety as seen by GAT-7 mean score. The majority of the students had reported feeling nervous, anxious, or on edge, not being able to stop or control worrying or worrying too much about different things, having trouble relaxing, becoming easily annoyed or irritable, and feeling afraid as if something awful might happen over the several days of the weeks prior to completing the questionnaire. The latter also required further exploration. And in conclusion, the physiotherapy students showed good CAP towards COVID-19 and moderate levels of anxiety. Positive attitudes and practices towards disease of vulnerable patients are care, promoting good health and preventing disease in population during a pandemic. The high level of CAP of your final year students was beneficial for their transition into the clinical practice where they would be faced with patients who would have been infected with COVID-19 and prepared them for this. The moderate levels of anxiety were of concern, especially as students experience anxiety related stress levels for several days. The latter needs exploration, and mental health and awareness and health awareness days have been incorporated into the program for our third and final year students who are involved in the clinical practice. Thank you.
Thank you very much. All right. Is our next speaker in the audience? Next, we have Dr. Callisto Blessimo Marim. If you are here, you are welcome to turn on your camera and start sharing your screen. Just to repeat the logistics, you have 10 minutes to present. I will turn my camera on around 8 minutes, leaving you with 2 minutes. Questions can be placed in the chat and we'll have a Q&A session afterwards. So Callisto Blessimo is going to speak on the numerical investigation of some malaria propagation models. Callisto is currently working on pursuing an MSc in mathematical science at UWC in the Department of Mathematics and Applied Mathematics. He graduated with a BSc in Honours in Mathematics and Statistics from Chinhoyi University of Technology in Zimbabwe in 2019. His research focuses on mathematical modeling with a particular emphasis on biological modeling. Thank you so much. We can share your, we can see your screen. You are welcome to proceed.
Thank you so much. I'm an MSc student in the Department of Mathematics, and my research title is Numerical Investigation on some Malaria Propagation Model. So malaria remains a major public health concern, particularly in poorly resourced regions. So researchers may simulate the development of the disease and evaluate the effects of intervention using numerical methods, which are invaluable tools for solving the intricate models of malaria transmission. Considering that the malaria remains endemic in many countries throughout the world, sustained research efforts should be deployed to provide more insight into the dynamics of malaria. For advancing the investigation of malaria dynamics, researchers have included control measures into mathematical models. However, these measures bring more intricacy to the models that are already highly nonlinear and difficult to deal with analytically. So it is therefore essential to develop a numerical technique to understand and predict the future trends. So by end of this research, I want to show a numerical method that accurately captures the qualitative properties of malaria propagation. Thus, the aspect of stability and accuracy are central to this particular presentation. Because of my time, let me just jump in straight to the model which I am looking on. This model was developed by Olanyi in 2013, and it was examined by a number of researchers. The fact that I choose it because many researchers, when they are looking on malaria propagation model, they usually exclude the compartment of exposed human. And this is a 7-dimensional equation model in which the human population is divided into 4 compartments, which is the susceptible human, exposed human, infected human, and the recovered human. Also, the vector population, which is the mosquito, is divided into 3 compartments, which is the susceptible mosquito, exposed mosquito, and infected mosquito. Due to their short lifespan, we don't have a recovered state for the mosquito. So let me just go through the first equation. Because of my time, I cannot explain all variables there. In each and every equation that you are seeing in this model, wherever there is a positive sign, it means there is a recruitment of population in that compartment. And wherever there is a negative sign, it means there is a decrease of population from that compartment. Considering the first equation, which is dSH dt, which is equals to lambda h. Lambda h, it is the birth of human which are coming into the susceptible compartment, and with the negative, after a susceptible human bitten by an infected mosquito at a rate b, they are transferring from the susceptible compartment to the exposed compartment at a rate beta h, and because of the natural death rate, which is the mu h, they are moving also out of that compartment. And with omega RH, they are coming, it is after they lose the immunity system from the recovery state and they are coming back to the susceptible. And as we can see on the blue box here, we have the initial condition for this model, which are positive. And from the previous researches that has been already carried in other research, because this model was examined by many researchers and there are some results that are already there based on that model, and my part is to advance the investigation of malaria propagation and introduce a numerical method that accurately captures the qualitative properties of malaria model and provide better, more results than the already which are established. So from the previous results that has been established, it is clear that as time goes to infinity, the total population approaches the birth rate over the mu h, as well as for the vector population. For the mosquito, there, as time goes to infinity, it approaches lambda m over mu h, which is the birth rate of mosquito over the death rate of mosquito. Therefore, all solutions are positively invariant in that region. And we have the disease-free equilibrium, which is given by that, which is E naught is equals to lambda h over mu h. And when we go for the susceptible mosquito, which is lambda m over mu h. And because of my time, let me jump into the development of this numerical method, which I'm talking about, because we have the standard numerical methods that are already existing, like the Euler method and the explicit Euler method, which are widely used in the analysis of diseases, and it actually applied in many kind of diseases. But because sometimes the diseases, they are taking long time in a population, and we need to examine the dynamics of these diseases. Henceforth, Euler method and explicit Euler method and the Runge-Kutta fourth order method, at the end of the day, they are using small steps which become ineffective when we are considering the long period in which the disease will affect the people, or like the long period of time in which the disease will become endemic in a population. Therefore, I'm proposing in this particular presentation, I propose a non-standard finite different method which accurately captures the qualitative properties of malaria model by applying the McCain's techniques. For the model 1, we are using this approximation DHXK, which is equals to FHF such that X is equals to K, where DHXK, it is the left-hand side of the model 1, and FHF of XK, which is the right-hand side of the module number 1. So I have 3 definitions so that I will develop this scheme. So the first definition says a finite different method 2, which is the one that we have, which is the HXK equals to FHF such that this XK is called positive if for any value of the step size delta Tx is element of R7, and it remains in this for all K element of natural numbers. Then the definition number 2 says a finite different method 2 is called elementary stable if for any value of the step size, the point E naught are the same as the equilibria of the differential system 1 and local stability properties are the same for both differential system and the difference method. And the third definition that I want to use is the one-step finite difference method 2, the one which is the HXK is equals to FHF of XK. For that method for solving module 1 is non-standard finite different method if at least one of the following condition is satisfied, which is now the left-hand side is approximated as xk plus 1 minus xk over the phi delta t, and this phi delta t is called the non-standard denominator function, and which is equals to delta t plus high order terms of delta t. And on the right-hand side, we have the non-local approximation. So by applying this definition number 3 to the model number 1, we are getting this discretized scheme, and this is now a discretized scheme of the model number 1 for malaria propagation model. As you can see from this discretized scheme, it is clear that since from the model number 1, we found that all solution, the initial solution are non-negative. Therefore, from the definition number 3, it says the numerical scheme also must also have the same result. As we can see from this scheme, it is clear that the positivity of solution is being preserved. And also when we are looking as t approaches to infinity, SHK also approaches lambda h over mu h. And also as t approaches to infinity, SMK approaches lambda m over mu h. And also when we are evaluating about the endemic equilibrium for this scheme, it is clear that all the eigenvalues for the Jacobian matrix for this scheme, they are less than 1 in the unit of the magnitude. Henceforth, the equilibrium point for the model number 1 and this non-standard finite difference scheme, they are the same. Henceforth, this is I can say this is the best numerical method that we can use because it exhibits the same behavior of the original model. Now, let me jump straight to the numerical simulations here. So in order for me to evaluate and say this is the best numerical scheme based compared to the standard numerical scheme like explicit Euler method and the Runge-Kutta fourth method, we have to analyze the error, the convergence rate, and the computing time. So we choose the best method with the smallest error possible and which is not computationally expensive, the one that takes less time when we compute it and with less error. Now, on that note, the same scheme, if we apply the method, which is number 6 here that I mentioned, SHTN minus SH plus these are state variables for the 7-dimensional equation in that model number 1, which is also on that discretized scheme, which we have. Now, by utilizing a step which is half time in order to get better outcome, if we divide the delta T1 and delta T2, it is always 2. Therefore, the rate at which we are going to use for our numerical simulation, it will be log 2 the error of the delta T1, delta T2, and delta T, it is the number of steps which we take. In the event, if we use the Euler method and we take the smaller step, the result will be efficient. But if we are now taking for the long period of time and apply this, it will be not efficient. Now, let me rush to the result of comparing my error terms and for the Euler method, Runge-Kutta, and non-standard finite different method. As you can see that the Euler method and non-standard finite different method, they are both order 1, and the error terms of the non-standard finite different method is very small. But when you look on the error term of the Euler method, it is smaller than the one, and it is small as well, but the non-standard finite different method gives a smaller error compared to the Euler and RK4, due to the fact that when we are looking at the computing time as well, non-standard finite different method is having a small amount of time compared to the RK4, because RK4 it have got so many computation on the right-hand side of it, and also looking on the Euler method is having a shorter time as compared to non-standard finite method, but because it fails to preserve the properties of the original model, henceforth non-standard finite different method will be the best. So in my conclusion, I can say for malaria propagation, we have showed that non-standard finite different method accurately captures the qualitative properties of malaria propagation. Therefore, it is the best method that we can use when we are predicting whatever the disease for a long period of time, and it preserves the qualitative features of the original model. Thank you.
Thank you so much for that insightful presentation, Dr. Callisto. Your comments will be held, or questions will be held, until the end of the session during the Q&A. Our next speaker is Dr. Tanya Stale. Dr. Tanya Stale, you are welcome to turn on your video and to share your screen so long while I introduce you. We'll just wait for Dr. Callisto to stop sharing.
Let me stop sharing my screen. Yes.
There we go. Thank you so much.
Wonderful.
All right. Dr. Tanya Stale will be presenting on the effectiveness of a structured aerobic exercise intervention for adults living with HIV/AIDS on HAART, a single blended randomized control trial. Dr. Tanya Stale is a senior lecturer and postgraduate coordinator of the Department of Physiotherapy at UWC. She joined in 2004 after 13 years in private practice. Her research focuses on health promotion and the prevention and management of risk factors for chronic diseases of lifestyle amongst adolescents, risky behavior in the elderly, and the elderly diabetes mellitus. She has expertise in mixed method research and the development of interventions. She has a passion for primary healthcare and improving health and well-being of individuals. She has published her work in scientific journals and presented at national and international conferences. Once again, welcome, Dr. Tanya. I am going to give you have 10 minutes to present. I'll put my camera on when you have 2 minutes left, and we have a Q&A at the end of the session.
Can I just
see your
if you can see
slides?
my screen? I could see it.
Yes, we can see your screen. It's a bit
I can't.
out of proportion. I don't know if you want to just put it in presentation mode. Let's see how it looks.
Does I?
There we go. It's perfect. Thank you. I am going to give you 10 minutes. I'll put my camera on when you have 2 minutes left.
Okay. Can you hear me?
We can hear you and see your screen. Thank you so much.
Okay, thank you very much. My presentation is the effectiveness of a structured aerobic exercise intervention for adults living with HIV/AIDS on HAART, and it was a single-blinded randomized controlled trial. I just want to mention that it is a work of one of PhD candidates in the department. This part of the study was done still under the supervision of our colleague, late Prof. Julie Phillips, so we dedicate the presentation to her. Yes, so for the background, the HIV pandemic is a global concern, and HIV-associated infections is one of the leading causes of mortality in the world. In 2023, an estimated 39.9 million people were living with HIV globally, while an estimated 23.6% of the South African population were living with the disease. Although a cure remains out of reach, HIV is a chronic illness due to the effectiveness of highly active antiretroviral therapy, also known as HAART. People living with HIV/AIDS are now longer living longer, but it is paralleled by aging with the health-related consequences of HIV, adverse effects of treatment, as well as multi-morbidity. In sub-Saharan Africa, the high prevalence of HIV-associated disability is present. It includes impairments associated with mobility as well as motor function, which in the end leads to reduced quality of life. Improving quality of life is particularly salient for physiotherapists, given the holistic approach in providing care for people living with HIV/AIDS. Exercise and physical activity is key management strategies for the improvement of physical function and quality of life in different patient cohorts, including people living with HIV/AIDS. The aim of the study was to determine the effectiveness of aerobic exercise on physical function as well as quality of life in people living with HIV/AIDS on heart. The trial was also registered, as noticed on the slide. The research setting, the study was conducted at Cecilia Makiwane Provincial Hospital in Mdatsane in the Eastern Cape. It was done at the ARV clinic, which see approximately 600 patients with this disease per month. If we just look at the consortia diagram, just to mention that considering that regular exercise could improve the quality of life levels by 35% of patients assigned to the intervention group, using a 95% confidence interval and 80% power, a minimum sample of 66 individuals were required. To compensate for dropout, a total of 80 individuals were screened for participation. After successful completing the screening, eligible participants were then randomized into two groups, namely the control group as well as the intervention group. And by the end of the 8-week intervention, 30 participants per group their data were used for analysis. I'm just going to show the inclusion and exclusion criteria. Basically, for inclusion, you have to be 18 years and older, HIV positive and receiving ART treatment for more than 6 months, classified as medically stable by a medical doctor, and they must have completed the physical activity readiness questionnaire at baseline. Exclusion criteria is also mentioned below. So it's the above, as well as if they answered yes to one or more of the questions of the PRQ, as well as cognitive or intellectual impairment, cardiac conditions, epilepsy, psychiatric conditions. Right, so after randomization, the intervention group, basically, baseline measurements were taken, as well as they received a pamphlet with health education regarding the benefits of general mobility exercises, as well as nutritional guidance. They underwent an 8-week supervised aerobic intervention, which was plus minus 45 minutes in total for 3 times a week. Each session included 10 minutes of warm-up, 15 to 30 minutes of in-house walk at 70 to 80% maximum heart rate, as well as a 10-minute cool down. At the end of the 8 weeks, the follow-up measurements were taken. For the control group after randomization, baseline measurements were also taken, and health education, they received the exact same pamphlet with the benefits of general mobility exercises and nutritional guidance. This group did not participate in any specific intervention like the aerobic intervention. They just received standard care during the following 8 weeks. The standard care included whichever physio they needed, whether it was for back pain, for shoulder pain, for asthma, whatever they came for physiotherapy treatment. All right, the outcome measures that were taken at baseline and after 8 weeks were measures of anthropometry, which was weight and height, so that BMI could be calculated. Then also a few cardiopulmonary indices like saturation, pulse rate, systolic blood pressure, diastolic blood pressure, resting heart rate, and then the student could calculate maximum heart rate as well as VO2 max. Then also 6 of the tests of the Simmons battery of function tests were completed. Just to mention that the Simmons battery function of test is a reliable and valid tool that was used already in a lot of cohorts of participants, and it's deemed as reliable and valid. For the quality of life, the World Health Organization quality of life BREF scale were used, which is also valid and reliable tool. It is self-administered, abbreviated version of the World Health Quality of Life 100. It only comprises of 26 questions, including 4 domains of physical health, psychological health, social relationship, as well as environmental quality of health. Plus, it has 2 separate questions which ask specifically about the individual's overall perceptions of their health, as well as their quality of life. If we look at the baseline characteristics of the groups, just to make sure that it's more or less in line, the data analysis plan that was followed was the Shapiro-Wilk test, which is a test for normality of small sample size that was employed to examine the distribution of cardiopulmonary indices, physical function, as well as quality of life. The p-value was less than 0.05, so the assumption for normality has been violated, and therefore non-parametric tests were used, like chi-square as well as Mann-Whitney-U tests. So when we come to the results at baseline, participants in both the control group and intervention group had similar pulmonary indices, as well as physical function and quality of life, except for one domain, which is physical health, where the intervention group had a little bit of a better score. Also, with regards to baseline characteristic of the groups, just to note that the mean age, there was a statistical difference in the mean age as well as in gender, where, for instance, the mean age of the intervention group was about 10 years more than the control group. For gender, to note, there was only 15 males of the 60 participants. 90% of the participants were unemployed, and 60% had an income of less than 1,000 Rand a month. So if we look at those results within the control group, before treatment and after treatment, with the use of the Mann-Whitney, with the use of the Wilcoxon rank test, it shows a statistical significant increase in the overall quality of life, in psychological health, social relationship, as well as environment. Also in the maximum heart rate and VO2 max, the sit-to-stand 6 minutes walk test, as well as balance. That is now if you compare the in-control group at baseline as well as after 8 weeks. So within the intervention group, they had an increase, also with the Wilcoxon test use, they had an increase in all the components of quality of life, as well as maximum heart rate, VO2 max, 6 minutes walk test as well as balance. However, a statistical significant decrease was found for the 15 meters fast walk, sit-to-stand, as well as SOC tests from pre to post intervention.
Dr. Stell, my apologies. Your 10 minutes are up. If you could please wrap up in the next minute or so.
Okay, thank you. So if you compare the control group and the intervention group, we can see that between the control and intervention group, an effect size was estimated by dividing the Z values with the square root of sample size and then interpreted on Cohen's criteria. So in this slide, we can see The participant in the intervention group had a significant increase in overall quality of life with a large effect size, as well as in all the domains of quality of life with effect size ranging between medium and large. So to conclude, it is just important for us to mention that due to COVID, this RCT was done during COVID, the student had to adapt her initial plan of using O'Brien et al.'s intervention, where a stationary bike would have been used and the intervention would have been 12 weeks. Her intervention was shortened to 8 weeks and she used in-house walk methods. So despite the change in the application of the intervention that was used, there was still an overall increase in quality of life in all 4 domains, as well as in 2 physical function tests. So aerobic exercise has shown to be a viable and inexpensive treatment option and should be included in the daily management of people living with HIV/AIDS, as it could potentially improve the physical function of people living with HIV/AIDS. Thank you.
Thank you so much, Dr. Staal, for that presentation. We will deal with comments in the Q&A session. We have 1 more speaker left. Our next speaker is Dr. Dada Oluwayesi Timola. I hope I pronounced that correctly. Dr. Dada, if you are here, you are welcome to turn your camera on and to share your screen while I do the introduction. Just again, for logistical reasons, Dr. Dada, you have 10 minutes to present. When you have 2 minutes left, I will turn my camera on just to notify you of the 2 minutes. All right. Dr. Dada is presenting on the characterization of salivary exosomes as a diagnostic biomarker for oral squamous cell carcinoma. Apologies for the pronunciation. I'm a lawyer, so all of this is interesting terminology for me. Dr. Dada is a postdoctoral fellow at the Faculty of Dentistry at UWC. He has a PhD in chemical biology from UWC as well. His PhD focused on cancer genomics, explored the role of exosomes and other circulating molecules as liquid biopsy for cancer. He has a special interest in oral cancer diagnostic research and the development of liquid biopsy for management of oral cancer in Africa. He is a recipient of the ICGEB Arturo Falarsi PhD Fellowship and SAMRC RCDI Nested Postdoctoral Fellowship. He has published more than 15 papers in reputable journals. Dr. Dada, we can see your screen. So I hand over to you and you'll see my face pop up when you have 2 minutes left.
So thank you very much for the introduction. I sincerely apologize. My laptop is having issues, so you can't see my face. So I don't know if I can continue with my presentation. Can you hear me? I just need a confirmation. Hello?
Yes, we can. You may proceed.
Okay, thank you. So good day, everyone. I'll be presenting on an ongoing research project on characterization of salivary exosome as diagnostic biomarkers for OSCC, oral squamous cell carcinoma in South African population. My supervisor is Professor Manu Shetty at the Faculty of Dentistry. So that's just my outline. My introduction: oral cancer is a malignant lesion which originates from the mucosal lining of various structure within the oral cavity, and it is the most common cancer in the head and neck region. More than 90% of all oral cancers are oral squamous cell carcinoma, and that makes it very important. And from the latest GlobalCan data, we found that the annual worldwide incidence and mortality of OSCC has increased compared to the 2002 one. Globally, Africa continent has the 3rd highest mortality rate of oral cancer, with more than 8,000 deaths in 2022. South Africa has the highest incidence and the prevalence of oral cancer in Africa, and that makes this study very important. If you actually look at the map, and just from the blue part of the map, it actually depicts the incidence of oral cancer the oral cancer generally in the world. But let's play a close focus on that of the map of Africa. We can see that the incidence of oral cancer in Africa is not as much compared with what we found in the Americas, looking at the map. But if you look at just down there, the red part actually depicts the mortality rate. And if you actually look at it, you discover that though the incidence of oral cancer is not that much, but what we find is that we have high mortality of oral cancer compared to, if you look at the North America, with very high incidence, they have low mortality rate. And the question is, what is responsible for this? Factors such as late presentation, genetic reasons, and diagnostic measure for early diagnosis, because cancer is actually highly dependent on early diagnosis. And that is why we are doing this study. So liquid biopsy is the gold standard for OSCC diagnosis is histopathological analysis. But recently there have been questions on the role of liquid biopsy in cancer diagnosis. And since the molecules that have been explored have been circulating tumor DNA, the CTC, and exosomes. And we're actually focusing on exosome in our studies. Exosome is actually extracellular vesicle, consists mainly of 3 subclasses, which is the exosome, the microvesicles, and apoptotic bodies. And exosomes are secreted by both normal and tumor cells and can serve efficient means for transferring intracellular content, allowing cell-to-cell communication within the tumor microenvironment and distant sites. And the exosomes are about 30 to 150 nanometer in diameter, and they are both secreted by both cancer cells and normal cells. They are distributed in many body fluids such as blood, saliva, and urine, and that's why we're actually using saliva for our project. And during cancer development, cancer cells secrete more exosome with significant changes in composition. This facilitates communication within the tumor environment and metastasis to distant organs. So what is the literature saying about this project? Different studies have explored the role of exosome as biomarker for oral cancer. A study by Patel et al. Showed the 4 partners of microRNA that can serve as potential diagnostic biomarker for OSCC, and other studies have actually looked at the role of exosome in OSCC diagnosis. A recent review that we published late last year, we actually look at liquid biopsy in head and neck cancer in Africa, looking at the state, and we actually, in our paper, we actually have this table. We've discovered that there's just only one study on exosome on OSCC that has been done in Africa, and that study was actually done in Egypt, and there is actually no study in sub-Saharan Africa. There's no study in sub-Saharan Africa. So we actually concluded that there's a wide gap between the development of liquid biopsies for specific management of head and neck cancer, oral cancer in Africa. So the aim of this study is to focus at investigating the role of exosome cargo as diagnostic biomarkers for OSCC in a South African population. And for the preliminary study, we got BMREC for it. We collected tissue, blood, and saliva samples from the clinic, and the samples are being processed and stored in -80 freezer. And exosome, we isolate our exosome using in vitro gene total exosome isolation kits. And exosome was isolated from saliva of 10 OSCC patients and 5 LD controls. And exosome pellets were resuspended in 100 microliter of PBS. So what's in our characterization of exosome, we use transmission electron microscope to characterize exosome, and that just to characterize the morphology, that's the shape of exosome now. And nanoparticle tracking of salivary exosome was also done just to determine the size and the concentration of exosomes in OSCC patients compared with the LD control. And what's our results saying? If you actually look at this result from the OSCC from the transmission electron microscope, you can see that the saliva exosome from OSCC patients are quite more than in concentration and in number compared to what we find in LD control patients. And if you can see this is actually how the nanoparticle tracking is done by Nanosite. It's just an infrared ray counting the number of exosomes and the number and the size of exosomes in the sample. That's how it looks like in the nanoparticle tracking. So from our result, you can see that the salivary exosome average molecular size is actually higher when we compare to, when we compare OSCC and EDI control, averagely the that of the EDI control have a higher size compared than the OSCC. But when we look at the concentration, we find that the concentration of OSCC, the exosome in OSCC is quite higher compared to what we find in the control. And we actually try to find a cutoff, what could be the cutoff value, trying to run a diagnostic test for the values we have gotten. For OSCC, for the exosome size, it's actually not significant. We can see the ROC, the area under the curve to be 0.16, while by that for the concentration is 0.89. And we actually found that the ID cutoff value for the concentration of salivary exosome that can be used as diagnostic test is about 1.99 raised to power 9. And that will be ID concentration for salivary exosome that can easily or significantly separate OSCC patients from LD control. So on discussion, our study is the first sub-Saharan African study to explore the role of plasma exosome cargos in the diagnosis of OSCC. It is an effort towards developing an African-based novel nucleic biopsy-based diagnostic marker for OSCC. Our primary finding shows a significant higher concentration of exosome cargos in saliva of OSCC patients when compared with EDI control, in line with study by Glotrid Och et al. In 2016, which reported the same finding among OSCC patients. Our findings also show an increased size of exosome sanguine in saliva of OSCC patients when compared with EDI controls, in line with the study by Box et al., which reported the same finding among OSCC patients in Australia. The ROC curve analysis of plasma exosome concentration was able to significantly discriminate OSCC patients from LD control with an area under the curve of 0.98, showing that this might potentially be a good marker for possibly, if not just only diagnosis, but even screening of OSCC among the general population. So future direction is that our plan is to make comparison between the plasma and salivary exosomes. Since we are getting plasma samples, we do the same thing in plasma and we compare what is the concentration of exosome in plasma compared to that what we find in saliva, and can we also reproduce this result we find in saliva in plasma. Or that is to actually extract RNA from the exosome and do some sequencing to actually know the dysregulated RNA, microRNA, for that might be specific for OSCC. And profiling of exosomal protein in both plasma and salivary exosome will also be done. In conclusion, our primary study shows the potential use of salivary exosome morphological characteristic as diagnostic biomarker for SCC, and there is therefore need for more study to explore the role of exosomal cargos as liquid biopsy-based biomarker for Africans in Africa by Africa. These are some of my references. My special thanks to my supervisor, SMRC, and Faculty of Dentistry. Thank you for listening. Thank you.
Thank you very much for that presentation. We have reached the end of our morning session, and we have a few minutes for questions. So I think there were some questions in the chat. If anyone else has a question, you're welcome to raise your hand. Just to give people the chance to prepare, I'm going to look in the chat and we'll start with those questions. All right, so from what I can tell, there is a question for Ms. Tisha. The question is from Selin Kosini, who asks, what informed the decision of using an exploratory descriptive qualitative study in light of the complexity of adherence counseling for TB or HIV co-infected patients? And I think there's a related question from Bulelena saying, can we please speak about our former President Thabo Mbeki's position on HIV treatment? He was against the use of ARVs and preferred to deal with underlying issues that perpetuate deaths. Nutrition and various socioeconomic issues are a huge contributing factor for immunodeficiency. So I think those are the first questions Wait, there's another question for nurses. Let me see. Again from Brulela. Nurses without formal training was mentioned as well. This is part of the indigenous knowledge, which usually indigenous knowledge which relates to inherent Black excellence. A perfect example of this is the fact that gardening staff have an extensive knowledge about the plants they've hired to water, and yet they've never been trained in pharmacy. I'm going to give, Ms. Tisha, are you here? So you have those comments that I've given you. There are more, and there is at least 2 more questions for you in the chat. Do you want me to read them, or do you want to address the first 2 questions?
Okay, Prof, maybe I should start with the first one regarding why the exploratory descriptive design was used.
Yes.
So this was to seek first-hand information from the participants, because very little has been researched from the nurse's perspective. So we wanted to have accurate, as a researcher, I wanted to have accurate information from the participants to share their experience, if really they do have counseling skills when they offer treatment adherence counseling to this specific group of patients. Bearing in mind that nurses are the backbone, especially in the community healthcare centers. So being the frontliners is very, very crucial that the nurses should be able, all categories of nurses registered with the South African Nursing Council should be able to offer basic treatment adherence counseling to this specific group of patients. So this was deemed the best design used to collect data for the study. I don't know if I've tried to answer that question.
I think so, unless the person who addressed the question has a follow-up
Elena.
question for clarity. Is there a follow-up question for clarity? All right, it doesn't look like it. Ms. Tisha, I don't know if you then also want to speak about the comment regarding President Thabo Mbeki, and then the comment regarding indigenous knowledge, and then I will read you the other question.
Okay, regarding the question on Thabo Mbeki's position on HIV treatment, well, this is a very sensitive statement. I hear what Bulela is saying, but remember we've got the WHO that stands as the advisory board, and which is regulated. So we need to implement whatever WHO is saying. So I don't think former President Thabo Mbeki can override the guidelines on HIV treatment of the WHO, the World Health Organization. Maybe I can also say that HIV care should be deemed as a multidisciplinary care. The approach should be a multidisciplinary focus type of care, because only the nurses are there, yes, to administer the medication. But now when we want to look at the underlying causes of death, then we will now be involving the social workers and so on. So if we can achieve this collaborative care package, then President Thabo Mbeki's issue is going to be resolved somehow, because the assumption is that this specific group of patients are not only being cared by nurses. It should be a multidisciplinary focus type of care.
All right,
Bulela,
thank you.
I'm not sure if I've answered your question.
Is there a follow-up question for Ms. Tisha? All right, it doesn't look like it. Ms. Tisha, there are 2 more questions addressed to you, and then I think we'll move perhaps to the other presenters. So the first one is, Ms. Tisha, how do nurses' perceptions on their ability to provide counseling match up with actual treatment results with their patients? For instance, nurses may feel that they are doing great a job in helping patients adhere to TB and HIV treatment, but if patients are still struggling with adherence or not achieving good health outcomes, there may be a gap between perception and reality. Is there a connection between how confident nurses feel about their counseling skills and actual adherence? So that's the one question. The other one is, do nurses feel supported by doctors, social workers, and other healthcare professionals in the adherence counseling process? And how important is this support? Did you
Okay,
hear the
so
questions?
yes, I do, Prof. So maybe I should start with the nurse's ability to provide counseling matching up with the actual treatment result. So this will be based on statistics, because if the adherence counseling is not being effective, then the loss to follow-up rate will also increase. And that we can only get from statistics. Then if we move to, do nurses feel supported by doctors? This brings us back to the point I made earlier, that the care needs to be a multidisciplinary focused care, because only the nurses cannot offer this. Hence, if the doctors can be involved, and I'm happy there's the use of social workers and other healthcare professionals, then the adherence counseling process can be a success.
All right, thank you. We do have a point for clarity from Bulela, writing that I spoke about African solutions to African problems. So why is that why are we taking the World Health Organization's word on this issue? Do you want to comment on that, Dr. Tisha?
Prof, this is a difficult one for me. I don't have a response to that, because I work with the international organizations, which is an international, WHO is the World Health Organization, and everyone is supposed to work according to the guidelines of the WHO. So when you are deviating from that, then it becomes another conversation that I don't think I am comfortable to engage in that, because I don't have any strong evidence to engage in such an information, in such a conversation. Rather, I will engage with anything related to the World Health Organization.
All right. Thank you, Dr. Tisha. That is a very sufficient explanation and acceptable. All right. Are there any questions for the other speakers? We had Ms. Violetu, we had Dr. Callisto, we had Dr. Tanya Stale, we also had Dr. Dada. You're welcome to turn your camera on or to raise your hand. I see we have a camera from Jabulani. Jabulani, you're welcome to pose your question.
I think that was not a question. That was just joining the meeting.
All right. Anyone else have a question or a comment for any of our other speakers? All right. It doesn't look like it. It is now 10:33. Our next session is going to start a bit earlier. Janine, if I'm not mistaken, at 10:45. Should we take a quick comfort break?
Yes, that's good.
All right. Shall we be back in session at 10:40? Is that okay? All right, everyone, I think let's be back in the next 6 minutes at 10:40. Then I will introduce the next speaker, give them time to set up and share their screen, and we'll start at 10:45. Thank you so much. All right, colleagues, welcome back to the second day of the DBC Research Week. We are on the second session for today, which is about transforming education. I would just want an indication. Let me see. All right, our first presenter is here. So our first presenter is Mr. Jabulani and Nicolette. So I'm not sure if this is a joint presentation. But you are welcome to share your screen and put your camera on and to get your slides ready while I do the introduction. Just a reminder that you have 10 minutes to present. When you have reached 8 minutes, I will turn my camera on to indicate that you have 2 minutes left. As usual, everyone watching is allowed to put comments or questions in the chat. We will have a dedicated Q&A session at the end of this, the whole session. All right, so Mr. Jabulani is presenting on online facilitation of the statistics module for critical skills in South Africa, a critical reflection for future strategies. Oh, I'm just looking for Jabulani's, abstract. There we go. Mr. Jabulani Shitanga is a senior psychology lecturer at Cornerstone Institute, bringing nearly a decade of experience in lecturing, research supervision, and retail industry management. Skilled in quantitative and qualitative research methodologies and online teaching, he has contributed to curriculum and assessment development in various institutions. His academic journey includes a BSc Honours in Psychology from the University of Zimbabwe, a BA in Psychology Honours from Cornerstone Institute, and an MA in Research Psychology from UWC, where he is also currently a PhD candidate. He has previously presented at the Council of Higher Education, the Psychology Society of South Africa, and Monash University. Nicolette, who seems to be a co-presenter today, is a master's research, has a master's in research psychology from UWC. She specializes in research methodology, statistics, and research supervision. Aside from teaching and supervision, she has also trained staff at various higher education institutions on the use of research methodology. She enjoys collaboration and cross-disciplinary work. Her research interests center around the improvement of the higher education space. All right, Jabulani, I confirm that we can see you. We can also see your slides, so you are welcome to continue. I'll put my camera on when you have 2 minutes left.
Good morning, colleagues. Can you hear me?
Yes, we can hear you.
Thank you for the opportunity. So, like I was introduced, my name is Jabulani, and my co-presenter, I believe she's here. That's Nicolette Sobotka, and also our colleague Natalie, but she's not available. So we are from Cornerstone Institute. I'm one of the lecturers in the psychology department, and I focus mainly on teaching statistics, research methods and statistics from NQF level 5, 6, 7, and 8. So the title of our project is the online facilitation of the statistics module for critical skills in South Africa. So it's just a reflection that we are providing in terms of what we are implementing in this space and what we can do to continue promoting statistics as a critical skill. So like what I've just said, Cornerstone Institute is based now we are in the Parklands area, also in Town Salt River area. So we provide a variety and a number of modules and programs, psychology undergrad and postgrad, of which we have honors and BPsych equivalent programs. So the psychology programs run up to NQF level 8. And we also have most of our students actually in the PGC, in the School of Education, where we also teach the Statistics A as part of the module for them to qualify to become teachers. So that is what we do. And then for our psychology students, we offer the statistics module as part of the research methods and statistics from second year third year at honors level as well. So that is what we do in trying to encourage the skills of statistics. So like what I've just said, in the just provide background. So we have the introduction to research methods and statistics module, whereby the introduction focus is more on the descriptive statistics. That helps our students to harness the skills of statistics, especially analysis. And then the research methods and statistics module that is offered at third year level focuses partly on the descriptive statistics as well as inferential statistics, the regression ANOVA, and the t-test. And then for our honors level, we have almost kind of advanced statistics where we combine everything, especially for statistics that speaks to relationship between variables for interventions, that is t-test, multiple regression, and the ANOVA. So those skills, we believe they are very important, especially when people leave universities for employability and when they want to implement and assess the interventions that are mostly provided, especially in the psychology field. And then for the statistics for education, we provide not quite a lot, but across board, especially for teachers when they engage in the education space. So most of these modules are semester modules, and our semesters are 12 weeks. They run from February, the month of Feb, and then up to the month of May, June, around then. So what we do with the programs, fortunately, we have the online, let us refer to it as an online space. And we also provide the modules in person, especially for the psychology students. So we do our best to offer interactive methods, especially considering the anxiety around statistics. Although statistics is important, and it was highlighted as one of the critical skills that is required, especially in the developing countries. And then we offer notes. We have Funda, similar to what we have at UWC from the Sakai platform, where we provide notes to students, and then we also make use of the Padlet exercises where students are able to partake in exercises, even using their mobile gadgets. And then we release some notes and motivation and announcements on a weekly basis to motivate the students so that they are almost comfortable in the space. So we do that even in the second year NQF level, that's 6 is it, and then NQF level 7 and 8, so that we provide as enough information to students as possible. And we also make use of the resources that students can revisit as an asynchronous activity so that they comfortable in the space. But now what's the issue then? After readings, variety and several readings in the literature, most of the studies were conducted somewhere else that focus on anxiety around numeracy and anything that has to do with numbers, especially in the social sciences space. And also, despite statistics being a critical skill that is likely and to help students become employed because of the skills that they have, even in making decisions. So this speaks to the goal number 4 and 8 of the UNESCO sustainability goals, and also objective 3 and 4 of our national development plan in South Africa. So that is what we are doing. I'm not sure if my colleague is here. Nick is supposed to be taking over the rest of the, okay, she's here.
Okay, thank you, Jabu. So like my colleague has mentioned, across the 4 different modules, we focus on sharing skills with the students. And a big focus of the module is not only on teaching the students how to do the calculations involved with statistics, but also on helping them to understand where and when statistics could be useful to them in their own careers. So we focus on helping students to understand specifically how they might use statistics to contribute towards economical growth in whatever career path they have chosen, whether it's psychology or education. Okay. So the strategies that we use, and my colleague has touched on this a little bit, but the strategies that we use in the modules is to provide lesson notes, pre-recorded videos. Sometimes there are live tutorials, and then sometimes lecturers also make use of external platforms such as Padlet and VoiceThread to give students a space where they can engage and practice the activities that they've learned. So what we did with this study is we drew information from the Funda platform, which is hosted on Sakai. And this gave us insight into how students are using the platform. And what we found from our research is that the most frequently accessed tool across all of the modules was the resources tab. So this was an interesting finding actually, because the lessons tab is usually where lecturers focus on presenting their lessons. So all of the notes, all of the recordings and everything are presented in a week-by-week format on the lessons tab. And yet students are still using the old format of the resources tab. So resources is just one tab where everything is kind of together in the same space. And one of the reasons for this might be that students find it easier to find what they're looking for when everything is together in the same space, instead of having to remember which lesson, whatever it is that they're looking for, is hosted under. Another finding was that there was an increase in activity right before assessments. So generally across modules, the attendance in the first lesson was really high, followed by a gradual decline, and then an increase right before assessment. But we also saw some unique visitors right before assessments, meaning that there were some students who didn't access the site at all, aside from right before the assessments. Another thing that we found was that the statistics lessons received more visits, double on average. So our lessons are split into research theory and then the statistical formulas. And the lessons that focused on statistical formulas received double the visits, suggesting that students feel the need to interact more with the lessons focusing on numbers. Okay. So some of the challenges we found was limited participation by students, particularly in the interactive elements of the module, like practice activities, for example. It's unclear why they're not engaging in the practice activities, because the literature suggested that practice activities are good for increasing statistical ability. So it's not clear whether they're not practicing at all or whether they're unwilling to practice on a public platform, but participation in that area was low. There was also unsustained participation between assessments, so students did not engage in a consistent manner from week to week. And there was also an increase in queries and requests for practice activities right before assessment. Some of the recommendations from our study is that there's a need to better understand what influences student engagement, particularly regarding the consistency or inconsistency of this engagement week to week. Future studies should also try to identify the reasons underlying the lack of engagement in the interactive elements. The results of our study emphasize the need for ongoing evaluation and adaptation to improve the content and format of online statistics lessons. So clearly, based on our results, there are some things that are not working for students. So there's a need to continue evaluation in this area. And the study's insights can be valuable for stakeholders in the educational landscape, especially lecturers in the statistics field. Thank you.
Thank you so much.
Thank you very much. Thank you also for sticking to the time. I really appreciate it. All right, I'm going to start introducing our next speaker. As I said, questions will be held at the end. The next presenter is Dr. Karen Collette. Dr.
Hello,
Karen
Angela. I am online. I'm just trying to get my video setting background correct, and we don't seem to be able to resolve it. So I'm just going to go straight ahead and then present, if that's okay.
That's fine. Do you have any slides that you'd like to share?
Yes, I do have. I will share my slides. Okay.
All
So
right,
I'm
while
going
you
to
share that, I'm going to just read your bio and explain what you'll be presenting on. So Dr. Karen Collette is going to present on response-able pedagogy, connecting global north to global south through a collaborative international learning course.
Okay.
Dr.
So,
Collette is a senior lecturer at the School of Leadership and Management in Educational Studies Department at UWC. She's worked in the areas of school teacher development through NGOs and higher education institutes in South Africa and Namibia. She has a particular interest in teacher well-being, school leadership development, and the development of schools as thinking and learning organizations. She was the South Africa coordinator and co-initiator of an Erasmus Plus partnership focused on teacher well-being and language diversity in collaboration with partners in HEEs in schools in Norway, Denmark, and Ireland. A new research interest is in the area of collaborative online teaching and learning, or online international learning, and the development of student academic literacies. In recent years, she has partners with professors from the United States and COIL and internationalization of the curriculum projects in teacher education. Dr. Collette, you are welcome to proceed. Do you have any issues with sharing your slides, or are you having a technical?
I'm just having a little bit of a technical glitch here. I'm trying to do entire screen. I'm not quite sure why it's not working, but I have got the slides up. So if you can just tell me if you can see the view coming on at the moment. So
we
if you
can't
can
see it yet.
Can you see the slideshow coming through?
No.
Gosh.
Janine, is Dr. Collette able to, is she a co-presenter, or is there a setting from our side that we can
They should be
adjust?
able to share. They can always email the slides and we can share from our side if needed.
Okay, I think this should be better now. Let me see if you can see it.
Yes, we can see it.
Okay, so I'll just do the slideshow from now. Okay. So thank you very much for the opportunity to present. So I'm going to speak about engaging in a responsible pedagogy, but particularly linked to the issue of collaborative online international learning and COIL and how this links to some of the Millennium Development Goals. So I'll be quite brief. I'm going to give an overview of COIL, look at some of the dimensions of a responsible pedagogy that we've used in our practice, and try and link some of the practices around COIL to some of the Sustainable Development Goals. So some of you might know that COIL stands for Collaborative Online International Learning. And basically, Berlin and Jones talk about the purposeful integration of international and intercultural dimensions into our formal curriculum, but providing the opportunity for all students. So it's a way in which we can engage in the internationalization of the curriculum, which is one of the key components of UWC's institutional operating plan, to talk about curriculum internationalization, but it is doing it through this particular lens, through this particular intervention. So it's trying to build courses that usually you'd see, a lecturer at UWC, for example, might have course A, and a lecturer at another university, it could be anywhere in the world, would have course Z, and it's a way in which the two lecturers would engage with each other in co-curriculum collaboration and setting a common integrated assessment task for their students. So in what we do is we actually force our students to engage with each other and to work on collaborative assessment activities. But as lecturers, we also co-plan our course curricula. So I think COVID-19 helped to kind of propel us all into using online and virtual learning, collaborative learning, various online platforms to make something like internationalization through COIL possible. So why do COIL, and particularly a focus on enabling internationalization without our students having to travel? So it's like bringing the world into the classroom and provide opportunities for faculty and staff from different parts of the world to work in collaborative projects with using various virtual environments. And I think for us in the area of teacher leadership development, engaging in this way, providing different forms of pedagogical practices are important modeling for our students. So we drew on in our research and in our pedagogy the framework of responsible pedagogy from Boslik and Zembelis, where we would look at building in aspects of attentiveness, curiosity, responsibility, and capability into the way in which we design our courses and assessment activities. So I'm just really going to now focus on, I think responsible pedagogy is a very important lens in enabling the Sustainable Development Goals to be reached for a range of reasons, and it speaks to the whole issue of education and quality education, which is one of the Sustainable Development Goals. So just to flag these ones, I would like to just look at issues related to how COIL can help to address quality education, reduce inequalities, address wicked issues such as climate change, and also contribute to reduced climate change through lower carbon emissions, and how a responsible pedagogy actually speaks to some of the partnership goals, all 17 partnership goals. So just in brief, you can see a whole lot of points here, and in previous slides I had them coming on one at a time. But what COIL does, it really provides opportunities for global and local learning internationally for our students and faculty. It helps to develop global competencies, intercultural competencies, and also to promote scholarship around teaching and learning through those linked-in environments. So as one of our students said, and you can see the little quote at the bottom, she said, you know that in a course what you'll normally have just done on your own with your peers, now suddenly it's like a window opens up and you've opened into another whole universe. And I think that experience, the student says, was wonderful for her. So I think COIL provides opportunities to reduce inequalities because students from a range of backgrounds, a range of abilities, a range of access to technology and also language proficiencies can engage with each other across the world. So I've put equal footing in kind of inverted commas because we do have challenges. And I think we all know the challenges to kind of equity in terms of being able to really connect through issues of load shedding, large classes, course requirements, and also the dominance of English. And that's a real concern in COIL. You know, we have to be mindful of these and also how we look at what knowledges are included or excluded in these kind of partnerships. But I think there are great potential opportunities here through COIL to look at addressing those inequalities and reducing inequalities. And many of our students at UWC are not given an international experience, and there's no reason why all of them shouldn't have that through COIL collaboration. So one of the good things is that, you know, you'll hear some of the internationalization focuses where students will be given opportunities to go and visit another country or do an exchange for a couple of months, which is a good thing, but we don't have the access to resources to provide that for all students. And this COIL is a way to directly provide that opportunity to reduce costs, to reduce carbon footprint in terms of travel and carbon emissions, and actually promote opportunities for ongoing engagement globally, and also increased opportunities for research collaboration. So I think what we found with our students, if you work with COIL and you work with it in a way in which you design your curriculum and your assessment tasks with a clear knowledge and understanding of the dimensions of a responsible pedagogy, it really has the potential to promote all those sustainable goals, all 17 goals in terms of partnership, because one sees that through both student and staff collaborating through COIL, that it changes people's perceptions of each other and each other's context, that together we start to find solutions to current and complex problems, and to build confidence of our students and ourselves to interact internationally, possibilities for ongoing contact and maybe more face-to-face contact in the future. I think for many of our students, it's modeling a pedagogy for future use, and also to strengthen our research focus and understanding as well as cooperation. So maybe just as a final word, I would promote Zembelis and Boslik's framework for a responsible pedagogy. I think it can foster awareness of global challenges while encouraging students and faculty to take ethical and collaborative action in addressing these issues. So moving from the local to the global. So colleagues and I have put a chapter in a book related to encouraging transnational learning through telecollaboration in global teacher education. So colleagues might be interested in looking at that. And there are my contact details for myself and Prof. Slipak if anybody would like to engage with us. And sorry for the whistle stop tour. Okay, I'll come back to you. Okay.
Thank you very much for this presentation and for keeping within your time as well. We are going to give over then to the next speaker. As a reminder, questions are held until the end of our session. Dr. Colette, you're welcome to, or if possible, if you can please take down your slides so that we can make room for the next speaker. Thank you very much.
I've done that.
Thank you so much. All right, our next speaker is Dr. Karen Koopman. Dr. Karen, if you are here, you are welcome to put your camera on and to start the process of sharing your slides. Dr. Koopman is going to present on traveling back home to the familiar towards Ubuntu career as a lived body curriculum. Dr. Koopman is a senior lecturer in commerce education in the Department of Educational Studies at the Faculty of Education. She completed her PhD at Stellenbosch University on the lived experience of accounting teachers. Her research mainly focuses on the phenomenology and curriculum studies. Dr. Koopman has published both locally and internationally. In 2020, she published a co-authored book with Dr. Oscar Koopman titled Phenomenology and Educational Research, Theory and Practice. In 2023, she published Decolonializing the South African University Towards Curriculum Self-Authentication with Dr. Oscar Koopman. In 2013, she was also the main editor of a special issue for the Journal of Education. Thank you so much for being here, Dr. Koopman. You are welcome to start your presentation.
Okay,
for some
good.
reason,
Are you
your
not-
slides up? Do you have slides?
Yes, and I said share.
All
Is
right,
all
there
right?
we go. Now we can see your screen. Thank you so much. Just as
Oh,
a
okay.
reminder, you have 10 minutes to present. I am going to put my camera on when you have 2 minutes left. Thank you so
Okay.
much.
Thank you very much, Angela. Just tell me if I move this, does it still show my original slides?
So
if I
it
do
shows, currently it shows your title slide. And when you can move it.
And if I do this, what do you see?
Introduction to Decolonization and Education, but we also see the rest of your slides.
Okay, no, wait. Can I just stop quickly? And I'm going
Yes.
to just, oh, great. And I'm just going to share the one where I wrote on the most. Okay, so that's that. Enter entire screen, share. And if it doesn't work, I'm just going to talk because it can't go on forever. Okay, and now?
We can see your slides. Perhaps just go to click on slideshow.
Oh,
at
sorry.
the top.
Okay.
Play from start. There we go. We can see everything.
Okay, good. So thank you very much, Angela. It is now 11:10 and I've got until 20 past. Or what? Right.
Yes,
So
I will put my camera on when you have 2 minutes left.
Okay, I'm not going to put my camera on. So here we go. The title of this presentation is, like Angela said, Traveling Back Home to the Familiar Towards Ubuntu Career as a Lived Body Curriculum. This is actually the closing chapter. It's number 7 in a book that Angela just mentioned, that Oscar and I wrote, called Decolonizing the South African Curriculum Towards Curriculum as Self-Authentication. I just want to quickly give you an overview of some of the, if I can manage all, then I'll do that, of the previous chapters in this book. Like I said, this is the last one, it's chapter 7. So the other chapters, chapter 1 is Rapturing rupturing the colonized discourse and its effect on the future South African university. And in chapter 2, the messiness of the neoliberal economic grip on the curriculum landscape. And then we've got about indigenous knowledge, and then towards an agenda for decolonizing knowledge. And then we've got a chapter on the Ubuntu conscious educator. And then there's one empirical study on pedagogical struggles facing life sciences lecturers in decolonizing their content. And so we worked our way towards this final chapter 7, traveling back home to the familiar, towards Ubuntu Kore as a lived body curriculum. Okay, so just to give you some introduction to decolonization in education, as we are now, after many years of talking about decolonizing curriculum, there's really no universally accepted definition therefore for decolonizing the curriculum or for decolonization. Generally, decolonization aims just to reshape the university curricula. Its focus on shifting from Western knowledge paradigms to African-centered approaches, or recentering African ways of life and thinking. And when I say African, I don't mean just a group of people who are called Africans. No, I mean all the people in Africa. We actually focus, trying to focus more on South Africa, but we talk about Africa in general as well. So still on the introduction to decolonization in education, it's about a curriculum grounded in African historical consciousness that resists Western dominance. Piner, who's one of the great curriculum scholars of, is still alive of this time, he says that, or he is of the opinion that curre, which is just the Latin word for curriculum, meaning a course to run, should potentially be about inwardness, a journey home, the return of what is repressed, excluded, or alienated. Let me just get on to the next section where I try to explain what decolonization means to me, or rather to us, the authors. So we believe that decolonization confronts the dominance of Western thought in academia. It seeks to decenter Western frameworks and include African experiences and knowledge. A decolonized curriculum connects students with their cultural, social, and political contexts, and emphasizes humanistic values unique to African ways. And if you just read that 1.5 lines there, that is what I said earlier on. So the question is, can the curriculum be used as a tool of control? Because this is actually what we are saying. It was used as a tool of control. Let's just see how it could have been used or is used as a tool of control. Curriculum is historically used to disconnect students from their cultural roots. Western curricula often fail to reflect African lived experiences and realities. Just think about when you were at school. Did your curriculum reflect your lived experiences and the everyday realities that you faced when you were, long ago, years ago, when you were at school? Most probably not. The curriculum has political, economic, and cultural agendas. Deleuze and Guattari, way back in 1983 already, referred to the ghost in the machine. And this metaphor reflects how curriculum actually imposes control. It's that hidden curriculum, We learned if you did education, if you studied education, then you would know about the hidden curriculum. So anyway, the hidden curriculum reinforces submission to Western norms and ideologies. And this brings me to our next point, which is the role of neoliberalism. Neoliberal capitalism influences modern university curriculum. The curricula often focuses on producing labor market-ready individuals rather than fostering self-awareness. Piner, the same chap that I referred to earlier on, this curriculum scholar, great curriculum scholar, he states that the ultimate interests of the ideological alliance reflect the incapacity to conceive individuality. Neoliberalism leads to the creation of a hybrid identity disconnected from cultural roots. The university curriculum, I almost want to say, I'm so sorry to say, serves the global capitalist agenda. The challenge is to create curricula that resists these forces and reconnect students to their historical consciousness. Maybe Ubuntu Kore is a curriculum for, and I put in brackets, South African students. Let's see. So this term Ubuntu Kore is a term that was coined by Leslie Lagrange. He's at Stellenbosch University. He happens to be my promoter years ago for my PhD. And he states that Ubuntu Kore ensures that the human cannot be defined nor have fixity. This means that Ubuntu Kore rejects fixed identities and embraces a fluid sense of self. Remember, earlier on I was talking about, I'm going to go back here, hybrid identity disconnected from cultural roots. That's what's happening. But this chap, Leslie, a researcher, he says that Ubuntu Kore, where was it now? Where was I reading? Emphasizes interconnectedness between humans and natural world. Oh, and I said here, the human cannot be defined nor have fixity. And Ubuntu rejects fixed identities and embraces a fluid of self. It encourages students to engage with their lived experiences and cultural history. It moves beyond Western models of curriculum that prioritizes skills over self-awareness. And that's what we are about. We want students to be self-aware. Self-authentication, remember, is part of the title of the book. Next, let's find out what Piner says about curriculum or Kore. Piner argues for shifting the focus from curriculum as a product to curriculum as a process. Yes, we all, in education, we also want that. Piner's concept of Kore as a journey home, and this is where the title, Traveling Back Home to the Familiar, comes in. So Piner's concept of Kore as a journey home is rooted in self-discovery and belonging. Curriculum should lead to understanding of the inner self. It should foster critical consciousness. It's a process, this process, centers on lived experiences and relationality between students and teachers. So what's this critical consciousness all about? What's the importance of critical consciousness? So we, Koopman and Koopman, in our previous article in 2018, believed or stated that we need to turn towards a curriculum underpinned by the development of a critical consciousness. Not that you are, when you learn whatever is in the textbook that's based on Western knowledge, that you can't think. That's not what we are saying, okay? What we are saying is use your experiences, where you come from, and who you are, to think about certain things, to continue and think about certain things, So anyway, so a decolonized curriculum can foster critical consciousness by drawing from lived experiences. Ubuntu Kore connects lived experiences with embodied knowledge. We sometimes also refer to as body knowledge. moving beyond textbooks. I don't know if everybody knows about them. I'm sure you do, because it's used it's used quite often nowadays, embodied knowledge. Critical consciousness enables students to question dominant ideologies and develop new ways of thinking. So a decolonized curriculum empowers students.
Dr. Quipman,
we're almost done.
apologies. Your
Yes,
time is
almost done.
up. You have about a minute to wrap up.
I am done. So the goal is to nurture different ways of thinking that reflect African realities and experiences. And there we have the conclusion. Do I have time to go through it? I'm just highlighting certain
Yes.
important points. So we believe that decolonizing the curriculum is about returning to the familiar, embracing your African ways of life, the values and the morals and things that you grew up with, that your parents taught you, which is quite different from the Western world. Bringing the student home is all about, I just said that now, sorry, your lived experiences. The journey home is one of self-discovery and reclaiming cultural identity. And this curriculum, we hope, will focus on how to think and not so much just about what to think. And we believe that this approach ensures that education is relevant and meaningful to African students. The end.
Thank you so much for your presentation, Dr. Quipman. Our next presenter isn't here, so we're going to move on to Miss Tammy Lee Williams. Tammy Lee, if you are here, you're welcome to start your camera and to share your screen while I introduce you. Miss Tammy Lee Williams is going to present on exploring the perceptions of health professional students regarding clinical practice during the COVID-19 pandemic. Tammy Lee Williams is a lecturer in the Department of Physiotherapy at UWC, a member of the Health Professionals Council of South Africa, and has received her Master of Science in Physiotherapy in 2019. She is currently a PhD candidate and submitted her dissertation for examination in July 2024. Congratulations, Tammy.
Thank you.
I hope that you receive good news soon. Her research interests include chronic pain and mental health. She often volunteers to attend community outreaches organized by UWC to supervise students while they manage chronic pain at community level. Tammy Lee has presented her PhD findings at local and international conferences. Tammy, I confirm that we can see your screen, and I also heard you a moment ago. You may continue. I will put my camera on when you have 2 minutes left. Thank you so much.
Thank you. And can you just check when I move, it moves on your side as well?
All right, you can move it.
I'm moving it?
Yes, it's moving.
Okay. I just want to start my timer on my side as well. Okay. So this was a departmental project that was also initiated by the late Professor Julie Phillips. And it was titled The Perceptions of Physiotherapy Students. Sorry, the title's changed a bit. Regarding clinical practice during the COVID-19 pandemic, recommendations for clinical practice education. So a bit of background for those not in the health professional field. Clinical practice education is a core element of physiotherapy programs in which students gain experience and knowledge in a practice setting. The presence of the COVID-19 pandemic, however, prevented health professional students from entering the clinical practice platform due to the lockdown measures that were implemented to contain the spread of the virus. However, as we know, there was a drastic increase in patients infected with COVID-19 and therefore caused a strain on the healthcare system worldwide. And many countries therefore had to send their senior or final year health professional students into the workforce as part of their clinical practice education. The pandemic, however, forced an abrupt change in the delivery of physiotherapy teaching, learning, and clinical practice without the time to plan and implement it effectively. So due to this unprecedented nature of final year health professional students entering the clinical practice platform during a pandemic and a lack of literature guiding this process, a need therefore existed to explore the perceptions of physiotherapy students, particularly from UWC, regarding the return to clinical practice. Our research question therefore was, what are the perceptions, readiness, and recommendations of physiotherapy students regarding their return to clinical practice amidst the COVID-19 pandemic? Our objectives were to explore the perceptions of final year physiotherapy students in relation to the support that they required from the physio department, as well as supervisors and clinicians as they return to clinical practice. To explore the fears or any fears of students returning to clinical practice, to explore their readiness, and lastly, to explore any recommendations for teaching and learning during a pandemic. Our methodology was a qualitative explorative approach, and we used a purposive sampling strategy. As physiotherapy lecturers seeking answers during a pandemic, students were purposively recruited based on their discipline as well as their year level, as only fourth year students were returning to clinical practice. The interviews were semi-structured and it lasted 20 to 30 minutes, and researchers were encouraged to follow up on answers which would provide deeper insight and understanding into the under-researched phenomena. Data saturation was reached following interviews with 9 fourth-year physiotherapy students. Therefore, there were no new insights or themes which emerged from the data. The interviews were recorded and each recording was transcribed. The authors analyzed the data using Braun and Clark's thematic analysis, which I won't go through, which I'm sure a lot of us know how to do it. And trustworthiness of the data was ensured through member checking by sending the transcripts to a few participants for validation, and all members of the research team were given a copy of the transcripts to ensure that the codes and themes were a true reflection of the transcripts. So our results, as I said, it was 9 fourth-year physiotherapy students, 7 were female and 2 were male, and the average age was 22.6. There were 4 major themes which emerged, as well as 11 sub-themes. So for the first theme, which is fears, the sub-themes were some of the students feared not being able to finish their degree due to the possibility of contracting the virus and the isolation period which accompanies the illness. And then the students were not concerned about their own safety, but they were more concerned about the safety of their family and spreading the virus to their family at home. And then with regards to their clinical performance, students were concerned about the impact that the personal protective equipment would have on the quality of their care with patients, such as building a rapport and their communication with patients, especially because of the masks that needed to be worn. In terms of the readiness, students reported that the Department of Physiotherapy provided adequate support in terms of knowledge preparation of what COVID-19 was, as well as the personal protective equipment. So one student made reference to the COVID-19 course, which the department enrolled students in, as well as the donning and doffing tutorial, which was provided on campus for students. So students noted that they felt emotionally supported by the department, as the clinical coordinator would send motivational and thoughtful messages to students in their WhatsApp group. And then lastly, in terms of their theoretical knowledge, many students did not feel prepared for clinical practice. However, this was unrelated to the pandemic, and it was more so due to the fact that they were starting some clinical rotations which they had no experience with, such as the ICU. And then in terms of the challenges, Students reported that the online mode of learning impacted their preparedness as they felt that they were learning in isolation. And then students also felt that they did not have ample opportunities to practice their techniques prior to starting clinical practice. And then for the recommendations, students recommended increased support be provided to them from all stakeholders, such as additional monitoring by clinicians, immediate communication channels with supervisors and lecturers, as they felt that clinicians would be preoccupied with the influx of COVID-19 patients. And they also requested emotional support from peers, and they suggested things such as a buddy system. And they made reference to WhatsApp groups. So the conclusion, therefore, is physiotherapy students at UWC experience fears and anxieties upon returning to clinical practice during the pandemic. They also shared how effective communication regarding the virus itself and the pandemic, as well as the PPE training or the personal protective equipment training, which the department provided, assisted in them feeling very prepared. Students further shared that departmental support is crucial and advocated for support from all stakeholders, as I mentioned, lecturers, clinicians, and peers. Students also felt that the online learning negatively impacted their readiness, particularly for clinical practice. And these results have influenced the teaching and learning of clinical practice in the physiotherapy department, whereby support groups on WhatsApp are still active for students to engage with past pupils, as well as supervisors and lecturers. Furthermore, additional practical tutorial sessions are available for students on a Friday to support their clinical practice learning and teaching. Okay, that's my time. Thank you.
Thank you so much for sticking to your time, and thank you for that interesting presentation. Our next speaker has joined. It is Miss Litwanelu Zwane. I hope I pronounced that correctly. If you are here, you're welcome to put your camera on and to share your screen. I will proceed to read your introduction or just your bio. Let me see. I'm just finding it. All right. Ms. Litwanelu Zwane is going to present on dislocating the body and transcending the imperial eye. Ms. Zwane is from Gugulethu, Cape Town. She holds education degrees from UWC and UCT. She is pursuing a doctorate at UWC as an International Research and Training Group Fellow and works as an associate lecturer in religion and theology. Her research focuses on African-initiated churches, African metaphysics, traditional leaders, and indigenous knowledge systems. Zwane is a practicing Sangoma, Gobela, prophetess, high priestess, and faith leader. She serves on the South African Human Rights Commission Advisory Board for Diversity, Education, and Training, and is a member of the Traditional Healers Organization and Association of the Study of Religions in South Africa. Welcome and thank you for being here. Just a brief reminder, you have 10 minutes to present. When there is 2 minutes left of your presentation, I'll put my camera on, just indicating that you should wrap up in about 2 minutes. Do you have any slides to share?
Hi, yes, I do. I'm not sure if you're able to see my screen.
No, not yet.
Okay, let me just try it again. Okay. Are you able to see it now?
No, not yet. Wait, there we go, it's loading.
Can you see it?
It's blank at the moment, so I can see your screen, but not yet any slides.
Yeah.
It's showing the whiteboard.
Okay, I'm not sure.
slides.
Okay. Let me just see
Reshare,
what
click on the
else
slides
I
rather than the
can.
whiteboard.
Let me just see what else I can do.
Still just your whiteboard.
Do you have your slides?
Okay,
If you want
are you able to? Yes, please. Yes, please, if you would be so kind.
Are they showing correctly?
Okay. Yes, that's perfect. Thank you. All righty. So as previously alluded, so this research forms part of my, or at least it formed part of my master's thesis, but I felt that it would be very useful to incorporate some of the ideas which I developed in that thesis in terms of helping us think about how we reconfigure and how we think about decolonial research methodologies and how specifically the work of traditional practitioners, namely Izangoma, can help us in how we actually do this. So moving on to the next slide, as I have stated, a lot of this work comes from my master's thesis and where I theorize about decolonial research methodologies and also where I provide practical approaches, because one of the things that I've come to find about when we want to reconfigure or transform methodological processes, our approach simply ends at the theorizing and we don't necessarily think through about how that looks practically. So leading us in that discussion, I make the argument of how the illusion of sight as a marker of what is real. So starting off on that argument would be the understanding that Western-centric knowledge systems are obsessed with positivism. So this is what can be seen with the naked eye or what can be proven scientifically. So a good, or at least one of the scholars from whom I draw in these arguments would be the work of Oyewumi, who makes a very compelling argument about the limitations of focusing on sight. So one of the key arguments here is how sight is but one of many equally important senses. So an over-focus on it, this allows us the possibility of experiencing other truth and other truths and other realities. Western-centric research methods are obsessed with sight, observations, and ethnographies as a research approach. And the problem with this is that Black bodies are always being viewed. And one of the key perpetrators of this would be anthropology as well as the medical sciences. So these are just some of the disciplines where the Black body is always being looked at. So now I move my discussion as how sight can be seen as metonymic or proleptic reasoning. I wish these were my own ideas, but unfortunately they're not. So here I draw from the work of De Souza Santos, who makes this very compelling argument about how Western-centric knowledge paradigms are limited because they're based on metonymic or proleptic reasoning. So De Souza Santos defines metonymic reasoning as being a reasoning that claims to be the only form of rationality and therefore does not exert itself to discover other kinds of rationality. So this means that sight as a common inquiry tool within social sciences research specifically is assumed to be the dominant marker of what is real. Added to that, when we look at proleptic reasoning, which is a kind of reasoning that does not exert itself in thinking of the future, because it believes it knows all about the future and conceives of the future as linear, automatic, and an infinite overcoming of the present. So based on that, it means that sight as a proleptic reasoning does not consider the possibility of a transformation of what it sees. That is, what is being seen now and what is being deduced from what is being seen is true and will be true 5 years or 10 years or 15 years from now. So Frank calls this finalization, which is when research or research tools establish themselves as unequivocal truths or establish unequivocal truths about research participants. So these truths do not lend themselves to be revisited or interrogated in the future. So there's an absence of going back to the drawing board or research being self-correcting and self-reflective or being open to correction. So in this way, research goes into what Frank calls a monologue, where it only seeks to speak to itself, regurgitate its own views, and occurs for its own sake. It becomes only a means for the gratification of academics in academic conferences and has no tangible transformative element for either the researcher or the participants. So now looking at how the work of Sangomas can act as a blueprint for how we think about decolonial research methodologies. So here I draw from the practice of ukubona or ukuboniswa as a research methodology. So in isiXhosa and in isiZulu, ukubona means to see. At least this is the surface level or the loose translation of that of those terms. On a deeper level, when we understand something, we also say ndiyabona or I see. Understanding is a process which calls in all of our senses. The focus is not just on the corporeal sight or vision, but our role in the process of understanding is being one who seeks this understanding to make sense of something from another person's perspective. To understand is a collective exercise, a collective meeting of minds. This is useful for how we conduct research, seeing the process as a meeting of minds rather than a monologue. So moving from that, we then have the concept of ukuboniswa, which means to be shown. Usually this is an unsolicited exercise. It is sporadic, but demonstrates a sustained connection to the spiritual realm. It denotes being open to spiritual knowledge or spiritual insights, which arrives through the process of ukubonisa or being shown. On one level, it means being open to other forms of knowing, so a knowing which calls in all of our senses. On another level, it discourages finalization or monologues, because by being open to ukuboniswa or being shown, we concede that we do not have all the answers and that there may be things which are outside of our experiential or even existential scope. Moving on from that, we then have what we call ukuphahla as a research methodology. So this makes the case for collective theorizing, collective authorship, so transcending the very individual focus or researcher focused research methodologies. So a transcendence of the imperial I. So referencing Amadlozi as co-author. So this means borrowing from the work of Izangoma. This means transmuting problematic tropes of who the knower is, problematizing power dynamics within research, recognizing subjects, quote unquote subjects, as co-creators of knowledge. So this also means decolonizing inquiry tools, as with ukuphahla, it is a conversation or a dialogue. So it is premised on seeking understanding and not assuming to already have all the answers. So in this way, one is a blank space, unassuming, and when we phahla, or at least when we actively perform ukuphahla, we kneel. So the symbolism of the kneeling is a testimony to one being humble and one having a sense of humility when one is doing research, particularly with marginalized, underrepresented communities. So there is an intentional inclusion, intentional research tools. So doing away with rigid questionnaires or rigid surveys that are very restrictive in terms of the types of answers that they want. Lastly, we then talk about ukuhlola or inhlolo as a research methodology. So this primarily is divination as a framework. So I'm not saying that researchers should be practicing divination, but what I'm saying is that the practice of divination allows us to use its frameworks for how we conduct research. So this means that the research tools themselves, they need to be contextual and suitable to the community. Ukuhlola is a knowledge-seeking process, which is a collaboration between the sangoma and the patient. So both have consented to this process and the benefit is mutual. The inquiry process is empowering for both, which helps us think through ethical research practices. So ukuhlola seeks to treat an issue at its core and not necessarily just the symptoms of it. Lastly, not doing research for research's sake or just to earn degrees, but being intentional in doing transformative, empowering research. So I think I'll end there. Thank you so much.
Thank you very much for that presentation. I'm going to start again with questions that might be in the chat. If anyone else has questions, you're welcome to raise your hand or put your camera on. The first questions, I think, are for Jabulani and Nicolette. So the question is, what do you think can be done to improve engagement in the interactive elements of the module? This is very important for online and remote modules. And then there are questions to Dr. Koopman, I think, as well. So Jabulani and Nicolette, do you want to take that question and then we'll move on?
I hope you can hear me. So that's a good question. We are also trying to do something about it, especially in the online space where students, like if you can see the results that we showed, students only visit the learning management system just before the assessment. And I think only for that. That is why we do our best to release the lessons and the resources on weekly basis. But also what we try to do is to make use of the asynchronous activities like the Padlet for statistics. That helps a lot because it's an application whereby students can engage in exercises and other activities in their own space and using a mobile device. So that is what we are trying to do at this stage, but it is difficult. And also to make it worse, we teach statistics and there are challenges around interest in such. So I think the use of asynchronous activities whereby students are able to use their mobile devices is helping at this stage, but we are still trying to find other ways.
Thank you so much. There is a question to Dr. Koopman, and I'm actually not sure, Dr. Koopman, if you have already responded, you can just clarify. The question is, what are the African cultural, social, and political contexts that will ensure and improve the livelihoods of Africans? In other words, curb poverty when implemented.
Yes, Angela, I actually responded to it already, to both of those questions. I copied the questions and then wrote response, both of them.
All right. Do you want to, just for the sake of the rest of the audience, just respond audibly?
Oh, okay. So the first one was, okay, so this one, the last one was about how to solve, what was it? Curb poverty, eh? Now, we don't propose to solve societal problems with a decolonized curriculum. No. Remember when I said in my presentation, with Ubuntu Korea, we hope to awaken a critical consciousness in the students. And we trust, or we hope that the students will then use, in other words, think about, critically use the context in which they live to solve the problems and not try to use the solution that they use in a country, for instance, in the West, wherever. But look at our situation, because we in South Africa, in Africa, we've got specific conditions in which we learn, things happen in our country that does not happen in the Western countries. So we can't use a model that they use in the West to solve problems here. So that's that. So a decolonized curriculum is not about solving problems, societal problems. No, it's about critically thinking about it and our own context.
All right, thank you. Are there any other questions for the presenters? I don't see any further questions in the chat. Anyone else, just as a final comment? Or any of the speakers, perhaps? All right, thank you. I think with that, we will then bring this second session to a close. I think there is lunch from 12:15 until 1, with session 3 kicking off then at 1 o'clock. So I want to thank all of the presenters for your insightful presentations and everyone else who were here and posed really thoughtful questions as well. Thank you very much. We will see everyone at 1 o'clock for the next session.